Great. Okay. So good morning, everyone. This is the Committee on Health Coverage Insurance and Financial Services. And we are gathered today for something like 20 plus work sessions on bills that have previously had public hearings. We're going to do our darndest to vote as many bills as we can today as we try and power through the last few weeks of our committee's work together for this year. We will start, as we always do, with committee introductions, and I'll just ask Christian if he would kind of type the order of bills, at least like the first 10 bills on the list, maybe into the chat box while we're doing committee introductions, and that might be helpful for those interested parties who might be hanging out in our Zoom to know that we're going to take up those 10 bills first. And then we'll go from there. We may end up skipping some of the bills or tabling them if we haven't, if we need to as we go along, but that should at least give people a sense of where we're headed at first this morning. Okay, so with that in process, I will have Representative Quint introduce herself.
Thank you. Good morning. My name is Tracy Quint. I represent House District 144, which is the Greater Holton area.
And Representative Matheson.
Good morning, everybody. My name is Christy Matheson. I represent District 1, Kittery.
Representative Connor.
Thank you, Madam Chair. Good morning, everyone. My name is John Connor. I represent House District 58, which is part of Lewiston.
Representative Arford.
Thank you, Madam Chair. Good morning. My name is Representative Poppy Arford. I represent District 49, the western part of Brunswick.
Representative Blyer.
Thank you, Madam Chair. Good morning, everyone. I'm Mark Blyer. I represent District 22, which is Leamington and part of Buxton, Standish, and Limerick.
Representative Malrano.
Good morning. My name is Gina Malrano. I represent House District 62, which is part of Auburn.
Representative Morris.
Good morning. I'm Representative Joshua Morris. I represent House District 75, which is Turner, Leeds, and Livermore.
Representative Matheson, did I skip you? Okay, I didn't skip you. Okay, never mind. Representative Tepler, go ahead.
Good morning. I am Denise Tepler. I represent House District 54, which is all of the town of Topsham, and serve as the House co-chair of the committee.
And I'm Senator Heather Sanborn. Hopefully I didn't skip anyone else. Let me know if I did. No? Okay, good. And I represent Senate District 28, which is half of Portland and half of Westbrook. And I can tell this is going to be an interesting day, given that we've already done 2 hours on Zoom and it's only 10 a.m. Okay, so with that, Christian has dropped the first few bill numbers into the chat so you can get a sense of where we're headed. And I will reiterate the request that Christian made in the chat not to use the chat for any substantive comments or offers of assistance or anything like that, but instead the chat is only for administrative use and really for the committee's own use if we need to link to documents or that sort of thing. That's the only purpose for the chat, so we would ask attendees to refrain from using it. So with that, I will find my own chart of our order of operations today. We're going to pull up and open a work session on LD 46. And Colleen, I assume you may have done 1481 together with 46?
I did.
Okay, great. So we'll open a work session on both of those and Colleen, have you do your analysis for us.
As Senator Sanborn said, I did do these two bills together because there are some similarities between them. LD 46 was one of the first bills we had for works public hearing in front of the committee back in February, but we tabled it because we understood that LD 1481 would be coming later and was addressing some of the same issues. So it is the first time we've taken up LD 46 since that public hearing, and then the public hearing on LD 41 was fairly recently. But LD 46 is a bill that's been put forward by the Bureau of Insurance. It's drafted as an emergency, and it would make some clarifications at the Bureau's recommendation to the surprise billing statute that was enacted in the 129th legislature. It provides that information on provider charges as reported by the MHDO, or if MHDO claims data is insufficient or otherwise inapplicable, another independent medical claims database specified by the superintendent must be used to determine the amount a carrier must reimburse an out-of-network provider. It removes the requirement that a benchmarking database be maintained by a nonprofit organization that is not affiliated with and does not receive funding from a carrier. It bases the amount a carrier must reimburse an out-of-network provider or an enrollee on the rate paid for a healthcare service in the geographic area where the service is provided, rather than on the rate paid for a healthcare service in an enrollee's geographic area. LD 1481, on the other hand, would eliminate the use of independent medical claims databases in the law and default to the carrier's median network rate if MHDO data is not available. The bill also would eliminate a provision in the current law requiring the carrier to reimburse at the provider's charge if the difference between that charge and the median rate is less than $750, subject to certain conditions. As I mentioned, the LD 46 is drafted as an emergency. So if enacted, that bill would take effect upon the governor's signature, and a vote, as you know, of 2/3 of the House and Senate is required for emergency legislation. Just some background and rationale from the Bureau of Insurance as to why they put forward LD 46. The first provision would remove the language requiring the benchmarking database, as I mentioned, to be maintained by a nonprofit organization that does not receive funding from a carrier. Because the Bureau believes that MHDO is an appropriate database to be used, and that actually is a specified database in the statute, since it receives a portion of its funding from carriers, the Bureau believes that this statutory clarification is needed. The bill also clarifies the authority the superintendent has to specify an alternative database if MHDO is not available. Some of the questions that were raised was from the Hospital Association, the Medical Association, is how would the Bureau specify that alternative database? What standards would be used? They suggested that the committee maintain the existing law. LD 1481, as I mentioned, proposes to eliminate the use of independent databases and instead proposes to use the carrier's median network rate until sufficient MHDO data is available. Carriers noted in their testimony that they believe it will take about a year until sufficient volume of data is collected by MHDO. They've begun that process, but they believe additional volume is needed to provide sufficient data on that those provisions. And then the second piece, as I mentioned, is a proposed repeal of the $700.50 threshold in current law. The carrier representatives noted their belief that providers will adjust their billing practices around this threshold to maximize provider reimbursement, and that may contribute to higher costs and premiums. They also noted that right now it creates an additional step in their systems to determine payment amounts and increases their administrative requirements on the part of the carrier. We don't yet have any fiscal information, but I would note that I believe you received some information, additional information from the Maine Association of Health Plans by email yesterday that Christian forwarded, following up on some of the provisions of LD 1481 and responding to some of the questions that came up at the public hearing. I'll stop sharing. I do note that you have representatives of the Bureau of Insurance here who can speak to LD 46, and I think you have representatives who can speak to LD 1481 if you have further questions.
Thanks, Colleen. So I will kick it off, as our committee usually is a little quiet when we first get started. So I'll kick it off by saying that I was actually persuaded by the additional information from the folks at the Maine Association of Health Plans yesterday that we shouldn't do anything with regard to federal law just yet. So it was the opposite of what they wanted me to be persuaded by, I think, but they pointed out that the federal rules with regard to how they would implement the No Surprises Act have not been finalized. And they had concerns about having dual track or competing rules emerge from that process. And I share that concern, but I think that it's premature for us to take action as a result. So my thought is that the Bureau can absolutely continue to monitor the No Surprises Act and bring forward another cleanup bill for us next session. And they're not barred from doing that in the short session. And honestly, this would probably get in as an emergency bill in the second session anyway, because of the change in federal, system. So I want to trust our Bureau here. And so I'm inclined to support LD 46, which is the Bureau's suggested fix to last year's surprise medical billing bill. And then I would not support at this time LD 1481, though I anticipate that a year from now, we might well be supportive of repealing the $750 and instead putting into place like a time limit or a time bar or something like that, like the 90 days that was suggested in the MEAP memo. So I actually anticipate we may do the things or one of the things in 1481, but a year from now, when we have a better sense of how the federal rules and the state rules can align better. Our bill that we just passed last year was the model for the federal bill. And our bill, along with New York, really laid the foundation actually to get a federal surprise medical billing law passed, which I'm super proud of. And I know how much stakeholder work went into negotiating every element of last year's bill and how much committee work went into it as well. And I just don't want to reopen those negotiations yet, because I don't know what the federal system, what conflicts it's really going to present and which conflicts we'll need to resolve as a result. But I feel like we will know that by a year from, or a little less than a year from now, early in the next session. So that's kind of where I came down. I'll open it up to the committee. Representative Morris, go ahead.
Yes, thank you, Madam Chair. I appreciate your what you are saying, and I know generally I would agree on the idea of waiting to see what the federal government is going to do. But if we are thinking in a year we're going to end up with the 90-day piece anyway, I mean, we can work with LD 46 if we could get rid of Section G, the $750, because I do think it is creating issues. And the other part of the letter from MEAP last night is the fact that people that have a high deductible plan may have to be responsible for covering all of a bill. So if you have a $2,500 deductible and the average network price is $500, but because this law says that if the difference is less than $750, so if it's $1,100, if you're in a high deductible plan and you have not met your deductible, you're going to end up paying more than if we eliminate that $750 number in the bill. And I think if we're thinking we may do it next year, why wait? Why not do it today?
Representative Tepler.
Thank you, Madam Chair. And I'm just curious what the Bureau thinks about Representative Morris's thinking.
Yeah, that's a good idea. We can ask, would the person from the Bureau who would be best suited to respond to that line of thinking about the $750 and replacing it with a 90 days, could they raise their hand and we'll bring you in? Good. Pardon me. Something stuck in my throat. Go ahead, Denise, if you could for a second.
Sure. Thank you for being with us, Superintendent. Representative Morris has suggested that we, in LD 46, we eliminate the $750 threshold. What does the Bureau think about that? Do you have concerns about it, or is it something that you would be open to?
I think we'd be open to it. We really haven't discussed it internally at any level, but the $750, particularly with the high deductible plans Representative Morris referred to, could present an issue for consumers. So I think we certainly are open to that idea.
All right. Are there additional questions for Superintendent Chapa? All right. Seeing none, is there additional conversation on the committee? Yeah, Representative Tepler, go ahead.
Thank you, Madam Chair. So I would be open as the sponsor of the department bill to Representative Morris's suggestion that we eliminate the $750 from LD 46 if it gets us a unanimous ought to pass vote.
And would you also put in place the 90 days batching requirement, as I understand it, that the federal government uses instead of the $750?
I guess I'm turning to the superintendent and saying, is that acceptable? Because this is a department bill.
I would say offhand, yes. But again, we haven't discussed it at length with internally, but the 90 days on its surface seems appropriate. Or acceptable, this is a better word.
And I guess I'm just wondering also if Representative Morris is comfortable with that then as well.
I think we'd be comfortable with that, yes. Yep.
Okay, so what that means, as I understand it, and Superintendent, please check me if I'm wrong on this, but is that for small discrepancies, if it's less than $750 discrepancies, there might be more. You could still use IDR, but you wouldn't be able to use it multiple times. And I guess what I'm trying to figure out is, what does that mean for the folks that, I mean, does that mean that you're sort of effectively rate setting it for that procedure, for that provider and insurance company for those 90 days? Or would there just be like certain individuals that kind of end up getting sort of unable to have IDR? I don't understand what happens during the 90 days. It's like a rate hold for 90 days and then you can relitigate it again 90 days later. Or is it just that only the patient who happened to be the one in the right window for the IDR gets the individual relief? I don't know if I've made that clear, but.
I think on that one, I'd like to bring in my general counsel. I don't want to speculate on that, if that's okay.
Sure. Yeah. He's on his way through the wormhole.
Thank you.
I can see him moving. All right, here he comes. Good morning, Mr. Wake.
Good morning. I would say that this is something I haven't studied thoroughly before this morning either, but the 90-day provision in the current law deals with a freeze on basically a freeze on substantially similar claims being decided differently.
Okay. So it would be kind of like a rate hold. Like once
Yeah.
we decide this once, then everybody gets that rate for 90 days. And then if the insurance company or the provider wanted to relitigate it, they could do it again 90 days later on a different
Yeah,
claim.
that's how it currently works as between the same carrier, same provider, different patients.
Okay, I'm comfortable with that. And I see Colleen nodding, so she understands it that way as well. So I'm comfortable with that sort of hammered out negotiation. This is real live legislating, people. We had not talked about this in advance. So how's that sound to everybody? Is that a motion? Does someone want to make a motion? Is there any further discussion? All right, somebody make a motion.
I'll move on to pass as amended with the changes we have been discussing.
And so it's a motion on LD 46, right?
Yes, yes.
Okay, and Representative Tepler seconds the motion. Is there any further discussion? All right, the clerk will call the roll.
Representative Quint.
Yes.
Representative Quint, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks. Could you unmute your mic?
Sorry about that. Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 12 yes and 1 absent.
Great. And Christian, can I just ask you to change your name maybe to be the bill number so that people can follow along, since we're going to do so many different bills today. It might be helpful for folks to be able to have that little visual cue. So thank you. Representative Morris, go ahead.
Yes, I would move ought not to pass on 1481.
Perfect. Seconded by Representative Connor. Now we're going to get ahead of Christian. I'm giving him a minute and then he will call the roll.
Representative Quint. I'm sorry, you cut out there. Could you say it again?
Sorry about that. Yes.
Representative Quint, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Chair, yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Stewart. Or, sorry, Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 12 yes, 1 absent.
I'm also going to take this moment to just give the hot tip that if you press your space bar, it does temporarily unmute you. So if you can't find your cursor, you can use your space bar instead. If you're just voting, it's really helpful during voting, and we're going to do a lot of that today. So you can always hold the space bar down and talk, and then you're unmuted. Representative. Okay. Starting the next one. The next bill is LD 56. Did you combine that with anything else in your analysis, Colleen?
I think I separated them. I thought about combining 56 and 556, but I did separate them. Yeah.
Okay, great. So we'll pull up 56 by itself. We'll have Colleen do her presentation.
Okay. LD 56 is an act to prohibit insurers and third-party payers from adjusting their fee schedules for in-network providers unless adjustments apply to all specialties. As it's drafted, it would prohibit carriers from making any change in reimbursement rates or fee schedules applying to any providers participating in the network unless those changes apply in the same manner to all participating providers able to provide that service within the scope of their license. It also would prohibit a carrier from discriminating against a provider based on their license in a manner that denies payment to the provider for an increase in reimbursement to account for a cost of living adjustment. I did want to point out that many of the proponents you heard from on LD 56 were chiropractors, and so I wanted to point out and remind you about a provision in current law related to reimbursement of chiropractic providers. Under the current law, carriers may not refuse to reimburse a chiropractic provider who participates in their network for providing a covered healthcare service, as long as the chiropractic provider is acting within the lawful scope of their license, consistent with reasonable medical management techniques specified under the contract with respect to the method, treatment, or setting. A carrier may not discriminate based on the chiropractic provider's license. The law does not require a carrier to accept all chiropractic providers into a network or govern the reimbursement paid to a chiropractic provider. This provision in state law specific to chiropractors really mirrors a non-discrimination provision at the federal level in the ACA that would apply to all providers, and it would prohibit discrimination based on a provider's license if the delivery of the service is within the lawful scope of their practice. So I wanted to point that out, that is in the existing statute. So some of the issues that you might consider is the impact if this moves forward on contract negotiations between carriers and providers. You did hear some concerns raised about the difficulty to contract on the part of small independent providers with carriers because of a lack of sort of leverage in the negotiations. As mentioned, there were some questions about whether the bill would require that all providers be reimbursed at the same rate, and is it appropriate to treat all providers equally? And then the second piece, which I think is from the testimony, it seemed to be indicated by the providers as the focus of the bill is the issue related to cost of living increases. As drafted, I think the bill would mandate cost of living increases in reimbursement rates. Testimony, particularly from the chiropractic providers, indicated that they have not provided for cost of living increases to all providers equally on the part of carriers. But I think that if the bill moves forward, I think there could be some consideration to amending the language to further focus that this is the intent of the legislation if you move forward with it. You did have some testimony indicating that while there are some contracts that do provide cost of living increases, there were some concerns about if it's mandated in all contracts that might be inconsistent with sort of the movement towards performance-based reimbursement arrangements as opposed to fee-for-service. And then lastly, the Bureau's testimony that they provided, neither for nor against, indicated that as a general matter, sort of contractual issues between providers and carriers are not within the Bureau's regulatory authority. That's left to private contract negotiations. And we don't yet have any fiscal information about the bill. I'll stop there and I'm happy to answer any questions. And I know you have folks here in the room if you have any further questions.
Are there questions for Colleen? All right, not seeing any questions for Colleen. Are there comments from the committee? Representative Tepler.
Thank you, Madam Chair. I just want to say that I've been unable to reach the sponsor and she doesn't seem to be on the call at the moment. So I just want to express that small concern that I've been unable to reach her and she's not with us at the moment.
Okay. So are there comments on the bill? Representative Arford, are you raising your hand? No, okay. So I'll comment on the bill, which is that, you know, I don't think that we, generally get involved in requiring insurers to give any sort of specific reimbursement rate to types of providers. And I don't think we should start now. I think that someday when we have a single payer and we have to set the reimbursement rates for all providers, that's a great day for us to have this conversation, but that day is not now. I'm making Representative Morris laugh. You know, at some point, perhaps we would be responsible for figuring out how much chiropractors should be reimbursed. But other than in May Care, that's not the legislature's job right now. So I would move ought not to pass on LD 56. It looks like it's seconded by Representative Matheson. Or is there any further discussion about the bill? All right, seeing none, we'll have the clerk call the roll.
Representative Quint?
Yes.
Representative Quint, yes. Representative Connor?
Yes.
Representative Connor, yes. Representative Blyer?
Yes.
Representative Blyer, yes. Representative Morris?
Yes.
Representative Morris, yes. Representative Matheson? Oh.
Sorry about that. My video is a little shaky today. Yes.
Representative Matheson, yes. Representative Evans?
Yes.
Representative Evans, yes. Representative Arford?
Yes.
Representative Arford, yes. Representative Melorano?
Yes.
Representative Melorano, yes. Representative Brooks?
Yes.
Representative Brooks, yes. Senator Stewart? Senator Stewart is absent. Senator Brenner?
Yes.
Senator Brenner, yes. Representative Tepler?
Yes.
Representative Tepler, yes. Senator Sanborn?
Yes.
Senator Sanborn, yes. That's 12 yes, 1 absent.
Okay. The next bill is LD 556. And we'll have Colleen do the presentation.
Okay, I think everybody can see 556. This is another bill that deals with issues raised by related to chiropractic services. As it's drafted, LD 556 provides that the copayment or coinsurance amount paid by a patient for services provided by a chiropractor may not exceed the copayment or coinsurance amount for services provided by a primary care provider. As drafted, the bill would apply to individual and group health insurance policies issued or renewed on or after January 1 of 2022. As I mentioned, with the previous bill, there is a provision in current law related to non-discrimination against chiropractic providers for their services. And I just want to note that the statute and the federal law guidelines make it clear that the provision does not impact reimbursement, at least as the current law is drafted. LD 556 would make a change, obviously remove that language, and then include the provision that the copayment or coinsurance amount for chiropractic services need to be on par with that of primary care provider services. There were several issues raised related to this bill. Proponents indicated that chiropractors are now often treated as specialists under health plan designs, and so the amount of the copayment for specialty care is often more than the cost of care for a chiropractic service, so patients often pay the full charge for a visit without utilizing their insurance coverage. Additionally, they also raised concerns about a requirement by some carriers for payment of 2 copayments, one for sort of the manipulation code and then one for any additional therapy service that might be provided during the same office visit. Carriers also expressed some concerns about the impact on costs and health insurance premiums if there is a shift in how chiropractic care is treated with regard to copayment and coinsurance as part of plan designs. And then the Bureau of Insurance noted in their testimony that they haven't heard from consumers about this issue, but they have heard they have been contacted at least once during the past year by a chiropractor about the practice that I mentioned about related to specific CPT codes in terms of therapy visits versus manipulation visits. What I didn't include here, and I should have, is the other issue that I think was brought up during the public hearing on this bill was the extent to which this might impact the clear choice designs that the Bureau of Insurance has developed in accordance with statute for individual plans, standardizing those plans as you move forward. And if this legislation moves forward, to the extent to which that might be inconsistent with the clear choice designs that the Bureau has developed and adopted through its rulemaking process. I'll stop there, and I'm happy to answer any questions. I know you have folks here in the room as well.
Yep. Are there questions for Colleen or for anyone else who is present in the work session? Representative Matheson, go ahead.
Thank you. Thank you, Colleen, for that summary. Can you just clarify that in this bill, there really isn't any wording that takes care of the complaint about the two co-payments, correct? In the language of this bill?
No, am I unmuted now? Okay. No, as the bill's drafted, it doesn't speak to the two co-payment issue that you talked about. And that was mentioned at the public hearing. As it's drafted, specifically, it really just gets at requiring the co-payment or the co-insurance for chiropractic care to be the same as for primary care.
Okay. Are there additional questions or clarifications for Colleen or anyone else? Representative Tepler.
Thank you, Madam Chair. I just want to clarify that the clear choice plans to be offered in the next calendar year have been designed already, but that there will be opportunities for discussion and renewal of those plans annually. So I guess if we can get someone to confirm that. I see the superintendent has his hand raised, Madam Chair.
Okay, we'll bring him in. Good morning, Superintendent. Is there an annual process of reviewing the clear choice plan designs?
Yeah, the statute requires an annual, and that includes meeting with stakeholders.
Right. So yeah, so my thought on this bill is that this is about plan design. Really, where you set your copays and deductibles is about, or co-insurance is about plan design. And to the extent that we get involved in plan design at all, we do it through the clear choice plans. Anything outside of the clear choice plans, we don't get involved in all. But with regard to the clear choice plans, there's a way to get involved in that plan design. And that way comes up around every single year. So there's an opportunity for the chiropractors to make their case in the next round. Representative Connor, go ahead.
Thank you, Madam Chair. Yeah, I got a message from one of the stakeholders regarding that, and I just wanted to make sure that they were going to be included. If they weren't on the last round of the clear choice, they will be included moving forward. Is that my understanding? Is that correct?
Yeah, I mean, we only one of the four groups four meetings did we actually invite specific people. The other three meetings were open to any member of the public. We will specifically make sure they're on the list for next year.
Thank you. That's all I have, Madam Chair. Thank you.
Yeah. And you know, the rulemaking process is open to everybody, but you do have to you have to kind of engage with it rather than necessarily being invited. I think, which does trip people up. It's kind of a problem, but it's also just kind of the nature of a complicated democracy, unfortunately. Representative Tepler, go ahead.
Thank you, Madam Chair. Because of the conflict between this bill and the existing clear choice plans, which have been worked extensively by the superintendent and the Bureau, I am going to move ought not to pass on this bill. And that is that.
Okay, we have a motion. Is there a second? Representative Quint seconds the motion. Is there any further discussion on the motion? All right, Representative Arford, go ahead.
I just wanted to say quickly, I will be supporting this motion, and I am also pleased that we've identified a remedy for the Chiropractic Association to work with the next round of clear choice conversations through the Bureau of Insurance.
Okay, are there any further comments? Seeing none, the clerk will call the roll. Representative Arford, could you put your hand on? Thanks.
Representative Quint.
Yes.
Representative Quint, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 12 yes, 1 absent.
Okay. The next bill is LD 299. And this, we will also have our presentation from Colleen.
Great. Here's LD 299. This was a concept draft originally, but the sponsor, Representative McCrate, shared language in advance of the hearing to replace the concept draft. The bill as presented would change the title and make the following changes. One, it would require that as part of a proceeding for parental rights and responsibilities of a child, a court may order a child to attend counseling as long as the court verifies that the counseling will be provided by a professional with a valid license in the state of Maine to provide counseling and therapy to children. The bill clarifies that a person may not engage in the practice of professional counseling or profess to the public to be or assume or use the title or designation of clinical professional counselor, marriage and family therapist, licensed pastoral counselor, registered counselor, or conditional license holder without holding a valid license, certificate, or registration in the state. And then lastly, it would specify that it's an unfair trade practice for persons to represent themselves to the public as social workers, psychologists, or counseling professionals without a valid license to practice. As drafted, as I mentioned, section 1 of the bill, a court would be required to verify that counseling will be provided. If the court orders counseling as part of its decision, it's not a mandate that counseling be a part of a court order, but if it is something that in a proceeding related to parental rights and responsibilities, the court has that authority now. It just asks the court to further verify that the counseling that will be ordered will be provided by a professional with a license in Maine. As to sections 2, 3, and 5 of the bill, those are the provisions, as I mentioned, that would add an additional enforcement mechanism to the Attorney General by designating the unlicensed practice of psychology, social work, or counseling as an unfair trade practice. The Attorney General also has authority to investigate unlicensed practice, but this would give additional enforcement under the unfair trade practices provisions if the Attorney General saw fit to use those mechanisms. Sections 4 and 5 of the bill are the provisions that would revise the counseling professionals law and change it from a title act to a practice act. And really what that means is under the current law, which is a title act, as long as a person does not use the title of professional counselor or related titles or hold themselves out as a licensee, there is a potential for an individual to engage in the practice of counseling without being licensed. Under a practice act, the language would specify that only individuals who are licensed can engage in the practice of counseling and use that title unless exceptions apply. There are some exceptions in the current law. Those would continue. They aren't changed in LD 299. And so those would continue. If you have some questions, we can talk further about what those are. The Board of Counseling Professionals did suggest in their written testimony that if the committee moves forward with sections 4 and 5 of the bill, that practice acts are the norm for other mental licensing statutes, and other categories of professionals are for licensing are governed under practice acts, and this would make counseling professionals consistent with those other types of licenses. They also, the Board of Counseling Professionals also suggested that the committee might consider an effective date for the provisions to allow individuals interested in providing counseling services as defined in the bill some additional time to obtain the education and training necessary to qualify for licensure, as this bill does sort of transition from a title act to a practice act, as I mentioned. We don't yet have any fiscal information related to the bill if it moves forward. And I will stop there. I'm happy to answer any questions. I'm just looking really quickly to see if you have representatives of the board here. I think you do have representative of the board here if you have any further questions, and I'm not sure if I see Representative McCrate as well, but I'm happy to answer some if you have them. Thanks.
Are there questions for Colleen? All right, I don't have any questions for Colleen, but I think it would be helpful to have Ms. Halverson join us briefly. Good morning, Ms. Halverson. Can you hear us?
Can you hear me?
Yes, we can. Okay. So thanks for joining us. My question is with regard to the effective date. I'm a little bit confused about the idea that let me start over. I think that this provision wouldn't actually change the rules about what education and training you need to qualify for licensure. Is that right?
Yes, it wouldn't change them.
It would not change them, but there might be folks out there who are currently doing things that would be considered professional counseling. They can't be calling themselves professional counselors, but they might be engaging in the practice of professional counseling currently and would have to stop at some date certain or get licensed. Is that right?
Correct.
Okay. Okay. I'm still a little puzzled as to who wouldn't fit under exemptions to licensure currently, but might be tripped up by this Practice Act because they can't call themselves a professional counselor. And then the exemptions to licensure are really, really extensive. So if they call themselves pretty much anything else, then they're exempt. So I'm just curious if you can come up with sort of like what are they calling themselves, or what service are they offering that doesn't fit in one of the exemptions?
So just from some examples, someone could be calling themselves an educator, but then also offering counseling services. Someone could have been offering life coaching or life counseling, but they're not calling themselves a professional or clinical counselor. And they're offering professional or clinical counseling services. And that impacts children a lot.
That impacts children a lot. Okay. Yeah. But if they're actually employed by a school, then they're not impacted by this statute, right?
The Department of Education certifies their counselors, their psychologists, and their social workers.
Okay. Representative Tepler.
Thank you, Madam Chair. I'm wondering if maybe we could ask the sponsor to tell us about the circumstance that she encountered a little more clearly so that we can understand what happened with the court appointing a particular person who wasn't a licensed counselor, or
Sure.
even not appointing, but allowing that. So I think having the sponsor weigh in would be helpful.
Representative McCray, welcome. Go ahead.
Thank you. That is so weird when you're coming in.
We call it the wormhole in our committee.
Yeah, Ms. Halverson described it well, actually. One issue came to mind, but then I discovered that this is a practice that isn't unique to the situation that I heard about. It was a situation where someone who presented themselves, just as Ms. Halverson said, as being qualified child therapists to do child counseling, to do child therapy, but was not licensed to do those practices, which is an issue whether it's court ordered or not. The court ordered piece was my attempt to close part of the loophole. The real issue here is that someone outside of those exceptions is, they're doing what they're doing as if they're licensed and they're not. So it's the kind of practice that requires licensure, whether it's social work, psychology, counseling, but the area that wasn't tight enough was the counseling statute. So this bill attempts to tighten up that so that it matches what's already in place in social work and psychology. If we don't have that, then the boards can't act if somebody's not licensed. And if the statute isn't tight, then the Attorney General can't act because the statute isn't clear.
Mm-hmm. Representative Tepler.
Thank you, Madam Chair. So I have two questions that go with that. One is the scope of practice for counseling to be defined in the practice statute? And would life coaches continue to be able to do their business as life coaches without a licensure? And then the other question is, I'm sorry, I lost the other question. I'll think of it in a minute.
Yeah, any exemption that exists still exists. So for example, recovery coach, intentional peer support, clergy, it's quite a list. And that's absolutely fine. The problem is only when you present yourself as if you're licensed to do what you're not licensed to do. And the reason for licensure is because it's an outcome of training and an agreement to follow the ethical standards and the standards of care under that profession. Life coach, recovery coach, clergy have different, they're not under that category. They just aren't. So they're not restricted by this to do what they do, as long as they're not presenting themselves as doing something they're not qualified to do.
Representative Tepler, is your hand still up?
Yes, remembered my second question. I'm sorry. My second question had to do with pastoral counseling and pastoral counselors. And to some extent, Rep. McCray has already answered that, but I guess for the sake of the committee, I'd like some clarity, particularly around the court piece and pastoral counseling.
Well, hopefully you got what I sent that came from Attorney Prescott, who sent guidance on the clergy issue is governed by statute. And there was a case in Maine that made it clear that courts do not have the authority to order clergy or to interfere with clergy. So a licensed pastoral counselor, perhaps Ms. Halverson could speak to that. It is a licensed category, but if you present yourself as a licensed pastoral counselor, then you've been trained in that area. You've gone through that program of study and licensure. It's not, as some of you know well, it's not easy to get a license. It's something that you should celebrate because you went through the gauntlet to get it.
Ms. Halverson, can you add? Can you add to the responses here? You've got your hand up.
I can. As far as clergy, clergy is one of the exceptions in the statute. So nothing in the law would apply to the activities and services of any priest, rabbi, clergyman, or minister of the gospel of any religious denomination when they're performing the counseling service as part of their religious duties or in connection with a specific synagogue or church of any religious denomination. And the other thing I wanted to answer Representative Tepler's question, the counseling profession, the scope of practice is defined in statute. It lists what the process of that is. It's in the definitions, which I just had in front of me but cannot find. So it lays out the procedures of counseling, and it talks about the methods and techniques that include but aren't limited to the following. Then it lists what a clinical or professional counselor does as part of the scope of practice.
Representative Connor.
Thank you, Madam Chair. I just have a scenario question, I guess. So it's my understanding that in this given case, if a judge were to order counseling, would they be able to take into account the family's religious beliefs and appoint that case to clergy counseling, or does it have to go to a licensed counselor per this LD? I'm just curious to know that question.
Is that for me, Representative?
Yes, it is. I'm sorry, I apologize.
That's okay, thank you. Well, first of all, what Attorney Prescott presented to me that I passed on was that the court wouldn't be in a position to order clergy. However, I know that the court would consult with the family on what they wanted. And it's not, if for example, in a child protective case, the court may order counseling. The family may be required to work with a particular area, but if they chose to work with clergy, there would be no reason that they couldn't do that as well. If the family, if it's a family court issue, a divorce, for example, I think you just moved. I think the court would, it's a process. The court would be talking with the family about what their preferences were. But we're not talking just, court is only a little piece of this. I was just trying to figure out where all the loopholes were that allowed, the case that came to me, and it's not the only one, had some pretty dire consequences that could have been prevented if, there are different levels of people's expertise, but somebody who presents themselves as somebody qualified when they're not only can it go wrong, but there's no recourse for anyone to address the problems that arose from somebody practicing something that they're not licensed to practice. I hope that's helpful.
Thank you, Representative. I appreciate that. That's all I have, Madam Chair.
Representative Quinn.
Yes, thank you. This is actually a follow-up to Representative Connor. I still didn't hear the answer though, whether or not that the family. Can you hear me okay?
Representative Quinn, you froze in the middle of your question, so why don't you start over?
Okay, can you hear me okay now?
Yes.
Okay, so I still didn't hear the answer to the question as far as whether or not the clergy would have to be licensed. This is where I'm having some difficulty with that, because I'm reading that it says they would have to be licensed in order to be involved in that sort of scenario. And I know that often you have someone that may have 30 years of experience in this and has done very well. And for them to have to go and get a counseling degree, I mean, that can take quite a long time to do. And so that's where I'm really on this bill, I'm wanting to say no to it unless that piece of it can be clarified for me better. So
I'm gonna try and answer it because I think that Representative McCrate has answered it, but I want to make sure that I'm right in what I'm summarizing. So let me give it a shot, which is that I think under current law, and here's where it would be helpful if Representative McCrate could respond, or maybe Colleen. I think under current law, if we don't do anything, a judge can't order you to go see a religious person or, you know, a clergyman. That would not be a thing a judge could order because of separation of church and state or establishment clause concerns. And so if we pass this bill, a judge similarly cannot order you to go see a religious person. That doesn't mean you can't go see a clergy person as part of the process as a family that you determined to do, or that you couldn't even choose, if you're ordered to seek licensed counseling, to seek out a licensed counselor who also has a religious perspective or background. But if the court is ordering it under current statute, if we do nothing, they can't order you to go see a clergy person as part of a court order. And that wouldn't change whether we pass this bill or don't pass this bill. And it really doesn't have to do with licensing. It has more to do with separation of church and state. Representative McCrate and Colleen, can you tell me if I'm off base on that?
That's my understanding. And then there is additionally on the issue of whether or not a member of the clergy needs a license as a counseling professional under current law. There's an exemption under current law which Ms. Halverson just noted, that provides an exemption from clergy having to be licensed in the performance of their duties as a member of the clergy. If they choose to be and provide pastoral counseling, that's a separate thing, and that is something that's required to be licensed. But if it's just someone who is seeing a member of the clergy and having discussions with them, and as part of their discussions, they might provide some advice and some counsel, they're not required to be licensed. But the interaction between the court and ordering of therapy, I think Senator Sanborn is right on in terms of the ability of the court to order someone to seek out a member of a particular religion, I think would be prohibited under constitutional provisions, not under the existing statute or under LD 299 as proposed.
Yeah, nothing would change. Clergy are exempt. They continue to be exempt. Nothing in this would change that. If people are really troubled about that piece of the bill and would like to remove that, the real core of this is to make sure that that we tighten up the counseling statute. That's the most important part of this bill. But I want to try to reassure you that in no way is this intended to prevent someone from seeking what they choose. It's just that when someone presents themselves as if they're qualified in a way that requires licensure, they need to be licensed so that they have the oversight of the board, which is under Christine's department. And without that, the board has no authority because the board oversees licenses, which is under Christine's department. And without that, the board has no authority because the board oversees licenses. By tightening the statute, if the person isn't licensed, it allows the Attorney General's office, which would have the responsibility to act. They can't really act right now because just as Colleen described, it's not the same there as it is in social work. And I think counseling is a newer profession than social work and psychology. So we're catching up in terms of the statute.
Representative Quinn, go ahead.
Okay, thank you. I appreciate taking the time to explain this, but this is one of the things that I don't want to get wrong. So with dealing with clergy, because when you get into religion, I mean, this is a big deal, and a lot of people have very strong feelings on this. So I understand everything that you're saying with the court order, but just going back to the counseling, I just want to do one more clarifying question, and that is, say that they go to see pastoral care, but then you have somebody that's not happy with the results of it, and then they turn around and say, oh, well, they were counseling us, but it needs to be counseled. Will this cause a problem for, litigation for the pastor if this was something where they went to it and then somebody said, well, we thought we're this or that? That's kind of where all of this is coming together for me, is that somebody who later then comes back and says, well, I'm not satisfied, and they were counseling us.
I don't think so, because they're not required to be licensed. I guess if you had a complaint, you'd go to the diocese or the overseeing authority, but it wouldn't change. They're doing what they're fully allowed and qualified to do as clergy.
Okay,
Yeah.
because I know that many clergy do say that they're into counseling. Does that then catch them with this bill? Am I making the?
Yeah.
Yeah, I think you are making yourself clear, Representative Quinn, and maybe Colleen, can you point out? I think it would be helpful to point out the actual text of. It might be even helpful to share it. The text of the exception for clergy, and then maybe the definition of pastoral counselor, which does require a license, but is different because it requires a fee or sort of more of that professional arrangement type of situation.
Yeah, I think I just pulled up the statute. If you can see it, is it big enough there?
Can you make it a little bit bigger?
See if I can make it a little bigger. I don't know if I can. Let me see. How's that? Is that big enough? It's right here in the middle. And this is the exemptions from licensure provisions in the counseling professional statute. And you'll see subsection 3 here that I'm highlighting. Nothing in this chapter may be construed to apply to the activities and services of a priest, rabbi, clergyman, including a Christian Science healer or minister of the gospel of any religious denomination, when performing counseling services as part of religious duties and in connection with a specific synagogue or church of any religious denomination. So that's the exemption that's in statute, and I think it's pretty clear there that they're not required to be licensed. Let me see if I can find the definitions for you. In the definitions section here, I'll try to zoom it up again. The definition of a pastoral counselor is in subsection 7A, which is right here again, highlighted in blue. An individual who's trained and certified to provide for a fee, monetary or otherwise, pastoral counseling. And then it describes the ministry to individuals, families, groups, organizations, and the general public, involving the application of principles and procedures of counseling to assess and treat intrapersonal and interpersonal problems and other dysfunctional behavior of a social and spiritual nature, and to assist in the overall development and healing process of those served. And then if you look underneath in subsection 8, these are all the procedures of counseling, which sort of further defines the scope of practice. But part of the distinction, I think, is the pastoral counselor is someone licensed to provide for a fee, monetary or otherwise, that pastoral counseling, which is sort of, as I see it, separate and apart from any counseling services that a member of the clergy would be providing as part of their religious duties, which is what's covered in the exemption that I just mentioned. Is that helpful?
Yes, thank you very much. Just the one question then, if they're into the pastoral counseling, then they would need to get the certification through the state. And for most of those, is that a difficult procedure? I mean, do they have to get a specific degree in counseling, or if they've already received? I think that's where I'm having the problem. They do have pastoral counseling. They've been doing it for 25 years. What the state is requiring is this like a full-on 4-year degree that they're going to have to go get in order to be certified as a counselor. Thank you.
Ms. Halverson, can you speak to that?
Hi. Yes, a pastoral counselor is actually a clinical level counselor, and they do require a master's or doctorate with 60 semester hours of education. In number 8 that you just saw, the professions, the procedures of counseling, the whole clinical aspect.
But nothing requires that a religious person do that. It's if they choose to, and it involves, if they choose to hang out a shingle, charge a fee, they may decide to do that.
Right. If they open a business being a pastoral counselor, then they would have to get licensed. But if they're a member of the clergy and doing it under the auspices of the church, then they're exempt. Representative Arford.
Thank you, Madam Chair. I too want to make sure to me, this is a very straightforward bill. It simply determines that a professional licensed counselor in the different fields we mentioned is set aside as a specific entity and cannot be confused legally with lay counselors, which are people who have not been professionally trained or licensed. The lay person can still call themselves a counselor. They simply cannot refer to themselves as a professional family therapist, family counselor, but the key to this is the professional title. Is that correct? Because there will always be lay people out there that are offering these types of services, and that may help Representative Quint, because there may be people that are offering spiritual guidance, but in a lay paradigm, not in a professional paradigm. Is that correct? Am I on target here with this?
Yeah, except that I would add, my father-in-law was a minister, and I can tell you he did a lot of counseling with a doctor of ministry, but he was not a licensed counselor. My brother-in-law is a minister, and he did choose to go get a marriage and family counseling license. That was his choice, but it's not required to do the counseling that a religious person does.
Okay. It seems like we've had a great discussion on the bill. Is there a motion on the bill?
Madam Chair?
Morris.
Yes, I think, well, before I'll just, from our texting on this, we are good with the bill. And I think, did I hear correctly that the sponsor was comfortable if we were to remove section 1 from the bill, the one that deals with the courts?
Yes.
Okay, so I would move ought to pass as amended by taking out section 1.
Would you also consider having a time frame for implementation of this requirement as suggested by Ms. Halverson?
Yes. Yep.
Okay. And Ms. Halverson, can you give us a suggestion as to what that time frame should be?
I believe 1 year would be a good time frame.
Okay, so that it would go into effect, let's say July 1 of 2022?
Yes.
Okay. Does that sound good to everybody? I'm seeing some nods. Okay, great. So with those 2 amendments, Colleen, that's the motion you've got the amendments. Okay, is there a second? Representative Quint has seconded. And is there any further discussion on the motion? All right, so the clerk will call the roll.
Representative Quint.
Yes.
Representative Quint, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 12 yes, 1 absent.
Okay, the next two bills that we're going to pick up are LD 368 and 1063. And Colleen, I'll have you do your presentation.
Can I just say thank you, committee, for all your hard work?
Thank you, Representative
you.
McCray. Thanks for joining us. It was helpful to have you here.
Oh, thank you.
Okay, Colleen,
Okay.
take it away.
Great, thanks. LD 368 and LD 1063, I did those together for purposes of the analysis because they both raised similar issues related to self-insurance and proof of financial responsibility under the financial responsibility requirements for operation of motor vehicles. LD 368 is a bill presented by the Secretary of State's office. It would change the laws governing proof of financial responsibility with respect to motor vehicles by clarifying the process for providing a deposit of money or securities as proof of financial responsibility in lieu of insurance coverage. It also would eliminate the ability of a corporation to provide proof of financial responsibility by satisfying the Secretary of State that the corporation has the financial ability to meet the minimum requirements. LD 1063 would provide specific authorization for qualifying religious organizations to satisfy the requirements for financial responsibility to operate a motor vehicle registered in the state through self-insurance. It does set forth some requirements that must be met before the Secretary of State may grant a certificate of self-insurance to a religious organization and its members. And it authorizes a member of the qualifying religious organization to provide the certificate of self-insurance granted to the organization itself as evidence of financial responsibility to register a motor vehicle owned or operated by that member. Under current law, owners and operators of motor vehicles registered in Maine are required to maintain minimum amounts of motor vehicle financial responsibility. Those amounts, minimum liability amounts total $175,000. The proof of financial responsibility under the current law may be demonstrated by an insurance policy that meets those minimum requirements, or the statute lays out 3 alternative ways currently. 1, by filing a certificate from an insurance or surety company with the Secretary of State. 2, by the deposit of money or securities. And then 3, for a corporation by satisfying the Secretary of State that the corporation has the financial ability to comply with those minimum requirements. Some of the issues that were raised at the hearing related to this bill, although the statutory authority for the deposit of money or securities has been in place in Maine statute for a number of years, the Secretary of State's office is not aware of its use. I apologize for the typo there, until a recent request by a member of a religious community. So LD 368 is their proposal to establish a framework for administering this option and allowing it to be available moving forward. As drafted, the bill would require a deposit of money or securities by an individual person in the minimum amount required in an insurance policy. So it would envision the deposit of $175,000 of money or securities. As the bill is drafted, it would require that those funds to be deposited with the Treasurer of State and would authorize the state treasurer to adopt rules. The rules language designates those rules as routine technical. Because they are routine technical, they don't have any further legislative review. You do have the option to designate those rules as major substantive if you wanted to have further legislative review before final adoption. Additionally, the bill as drafted doesn't require the rules to be adopted on a specific timeline. So I think if the committee was interested in sort of requiring that the rules be adopted by a certain date to allow this option to move forward. That's something that you might consider adding to the language of LD 368. With regard to LD 1063, I did want to note that there are a few other states that do provide this type of an exemption for members of the Mennonite community, particularly, and it's modeled on, the bill before you is modeled on language in several other states, including Georgia, Illinois, North Carolina, Kentucky, Maryland, Wyoming, and Pennsylvania. Tennessee and Ohio also have a language in their statutes. I provided a link to the Georgia law, which really I think was the model for how LD 1063 was drafted based on my review of the other state laws. One thing I did want to mention is that the bill would authorize the religious organization to provide coverage for the liabilities of its members related to the operation of motor vehicles. The Bureau of Insurance, the Secretary of State's office, and the insurer representatives did question about whether there might be adequate oversight to protect the financial interests of members and others, especially anyone who is who a member might have injured as part of a motor vehicle accident. If a religious organization could not pay claims against its members, then third parties could find themselves unable to recover for damages caused by a member. Some of the other issues, is there a need to treat members of a religious organization separately as in 1063, and LD 368 as drafted would allow the option for self-insurance to be, available to any person. Although I think the distinction between the two bills, as I read it, is really that the LD 368 would require each individual member to provide that deposit of money to prove their ability to self-insure, whereas LD 1063 as it's drafted would contemplate the religious organization being able to provide a deposit of self-insurance or a deposit of a certain sum of money for a number of vehicles, and members of that religious organization could take advantage of that self-insurance. The question was also asked about whether LD 1063 as drafted restricts the ability of some religious organizations to qualify for the exemption. The language in LD 1063 is modeled after similar language in federal law that allows certain religious organizations to qualify exemption from the payment of certain taxes for Social Security and Medicare. So it is tied to a requirement that the religious organization has been in sort of continuous effect for a number of years. I think it's 1950 that's mentioned in the statute as drafted, and that's consistent with provisions in federal law, just to provide that further information for you. And then, as I mentioned, LD 1063 permits coverage for more than one vehicle. The bill does not specify coverage for between 1 and 4 vehicles, but sets an overall coverage limit for 5 and 25 vehicles at $175,000 combined single limit, and for more than 25 vehicles, an increase of $1,000 per additional vehicle up to $250,000 would be required. And so I think as you're thinking about the proposal in LD 1063, consider that that would be lower than the current minimum requirements on a per vehicle basis, because it would allow sort of more of a group self-insurance, if you will, for those vehicles collectively, as opposed to a per vehicle amount. We don't yet have any fiscal information to point out to you. I guess I'll happy to answer any questions. I do think I might have seen an email that might have just come in with some further information about the bill. I haven't had a chance to read it. I just saw I just saw a reference to the LD number. But I also think you have representatives of the Secretary of State's office here. If you have any further questions with regard to LD 368, particularly Ms. Gardner is here, and I'm not sure about Representative Foster. I think he's on the call as well.
Thanks, Colleen. Are there questions for Colleen? Representative Connor.
Thank you, Madam Chair. Yes, Colleen, could you just repeat what you had said, what you believe the difference between the two bills were? I think I caught it, but I just want to be sure I have it.
Sure. I think the primary difference are two things. One, LD 368 would apply to any person to be able to provide self-insurance, a deposit of funds in lieu of procuring an automobile insurance coverage policy. It would require each individual person to deposit that minimum amount of $175,000 with the Secretary of State's office. LD 1063, on the other hand, as it's drafted, applies the authorization specifically to members of a qualifying religious organization. And in terms of the financial responsibility or the requirements for the deposit of money, it would allow, as it's drafted, members of the religious organization itself to self-insure for more than one vehicle at that up to between 5,000 and 25,000 vehicles could be insured, if you will, or satisfy the requirements of the statute with a deposit of $175,000. So it's that distinction between that amount per vehicle versus multiple vehicles under LD 1063. And then it also, if the religious organization qualifies and deposits those funds, as I read the bill, it would also allow members of that religious organization to provide that certificate of insurance to the religious organization to use that as evidence to register and their motor vehicles with the state.
Excellent. Thank you. I appreciate that.
Representative Tepler.
Thank you, Madam Chair, and thank you, Colleen, for your analysis. I'm reading this email that you mentioned, and as usual, CMP is late to the party, but their concerns are problematic for LD 368. So I guess we need to take a look at that because they say that they will raise rates if we require them to purchase insurance, and that is somewhat concerning. Although the fact that they didn't testify before and are just dropping into everything now really is annoying.
Yeah, it is annoying. I didn't see that email until just when it was mentioned, and it arrived at 11:06 a.m. this morning. I know that the Secretary of State has reached out countless times to CMP over the last 2 months, I think, if not even before that. But this was my concern all the way along, and I actually raised it with Secretary Bellows right off the bat and said, well, the problem with sticking it to CMP and making them buy insurance is that actually that means the ratepayers have to buy insurance because it's an administrative cost, and it gets passed directly on through electricity rates. So increasing insurance costs for CMP when they haven't had a problem, and when this hasn't been an issue, is a real bad public policy decision. So it's a cost shift I don't want to engage in. So there it is. Colleen, you were going to add something, I think.
No, I was just gonna, just on that point, I mean, I think that you could, as I mentioned, as I read it, they have the authority under the current law to take advantage of that sort of language related to a corporation. And if the committee was interested in maintaining that, you could certainly amend LD 368 to keep that provision in the statute.
Right.
And still provide this option for self-insurance that is contemplated in terms of depositing money with the Secretary of State's office.
I'm also slightly concerned that that email has not even reached the whole committee yet. Just looking at it, it looks like it was only sent to the chairs and leads.
You want me to
Colleen,
forward that?
Yeah, could you forward it to everyone for me?
I can. Doing it right now, including.
Okay,
Christian,
great.
So there we go. I think it should be coming.
I am seriously shocked that we're receiving this during the work session, but
And I'm just looking, I'm not sure if Ms. Newman is here in the room or not either, so I can't see on the
again,
type
like
list.
shooting ratepayers in the foot because CMP can't seem to figure out how to participate appropriately in our legislative process is like not good public policy either. Representative Tepler.
I was basically going to say the same thing.
Yeah.
I mean, they have lobbyists, they have a spokesperson, they have plenty of opportunities, and it's very disappointing and points out once again CMP's sense of invulnerability that has been a concern to Maine people, and that they can drop in to a hearing at this point. Very, very disappointing.
I don't see anyone from CMP in our work session. It would be lovely if we could get them to explain to us why they didn't respond until now, but I don't see anyone. If there is anyone, you could raise your hand.
Yeah, I don't either. There could be folks on the phone, but I didn't
Yeah.
see it.
Let's bring in Ms. Gardner and get her thoughts.
I can forward it to Ms. Gardner too, if I can find her email. I didn't
Yeah.
think about that. Let me see if I can do that quickly. Yeah, find her. I'll do that right now. Find her in the system.
Good morning, Ms. Gardner. Can
Good
you tell us
morning.
about efforts to reach out to CMP
Well,
along the way?
I don't have the exact dates in front of me, but numerous people from our department, including me, have reached out to CMP, have reached out to their lobbyists, to make sure that they were aware that this was there. And the thing I would say, as we said in our testimony, we don't have a position on whether CMP or any other company should be able to self-insure. What's problematic with this for us is that sort of oversight of it is tacked in our shop, and we don't really, it's not our expertise. We're charged with deciding whether CMP in this instance, or any corporation taking advantage of this, is really fit financially to do that. And we do the best we can, but we aren't insurance regulators. So our serious discomfort with it really is just in being charged with that responsibility.
Mm-hmm. Okay. CMP is certainly unlike other companies in that it's highly regulated monopoly that the state of Maine insures its financial viability basically through the PUC. They have guaranteed rate of return paid for by everybody who uses electricity. So there's certainly a very different entity. I wonder if we want to limit the applicability here to something like regulated utilities or something like that, and sort of grandfather CMP in, but in a way that wouldn't allow anyone else to take advantage of it. Just floating that on Mike for the first time as Gardner. So I don't know if you have any reaction to that.
The earlier phases of this bill, I don't know exactly when that dropped out, but looking as we research back to the origins of these exemptions in general, it was originally written to apply to a utility company, specifically. I'm not sure, without looking back again at the research, exactly when that provision dropped out.
Okay. But as far as you know, no one else has ever used it other than a utility company, and actually other than this utility company.
As far as we are aware, only this utility company has ever taken advantage of it.
And it hasn't created any issues in terms of unpaid claims or complaints or those types of consumer concerns that raised the reason why you wanted to repeal it, right?
Not that have come to us, but we aren't an insurance regulator. So in terms, I am honestly unaware of exactly what their claims process is.
Yeah. Representative Tepler.
Thank you, Madam Chair. I'm wondering if someone from the Bureau of Insurance, because we still have several members of that bureau in our in our attendee list might like to comment on whether or not this has been a problem. And then the other thought that I had, and I'm just throwing it out there to see if it sticks, is whether or not the PUC can provide the determination of viability of the corporation for the Secretary of State.
I don't know that question.
Mhm.
I would probably not want to do that without tabling the bill. Superintendent, go ahead.
Yeah, thank you, Senator. We have not had any claims or complaints that I'm aware of or my staff's aware of regarding CMP and payment of auto claims.
I don't want to cost ratepayers $500,000 to solve a problem that doesn't exist. And so that's my hesitation here, and my hesitation right from my first conversation with Secretary Bellis about the bill. I just thought maybe it wasn't going to cost us anything since CMP hadn't weighed in. But here they are at the last minute throwing a sideways wrench in our highly efficient morning of work sessions. I think what I would like to propose is to make a motion, because I don't want to table this bill. I want to solve this problem. I'm going to make a motion to pass as amended, but restrict the corporate use of this back to regulated utilities companies. And we'll have a chance to revisit it at language review. If we find out that there is some kind of reason why we can't do that, for some reason, I don't know what it might be, but because it's discriminatory against certain corporations or something, I don't know. If there's some reason why we can't do it, then we could revisit it at that point. So that would be my suggestion, is that we vote the bill today, that we get Colleen to check in about what the definition of that regulated utility could be, so that we capture that idea that the PUC is guarding their financial health anyway, which is part of the charge of the PUC. And then we could go from there. And I think that satisfies the concerns of the secretary. So that's the motion. It hasn't been seconded yet. Representative Morris, go ahead.
Thank you, Madam Chair. Yes, I think part of the issue on the two bills is one of the issues I know that was raised in Colleen's analysis is on that issue of and I guess I'd like the Secretary of State's office to weigh in on the piece before, I know, as you said, before CMP threw a monkey wrench into this whole thing, is the issue on the self-insurance from, as I understand it, the religious organization is looking to be able to insure all their vehicles through this. And as I understand it, it's not really insurance. It's kind of a bond. And that if there's an issue that they are considered to be at fault, they would then get the money from, or take the financial responsibility by going to their members in Maine and then throughout the country to try and take care of it. That they wouldn't be dipping into these funds that are held by the Secretary of State. At least that's how it's proposed in Representative Foster's bill. And so just trying to figure if there's a way to sort of, or what their take is on that, and if there's a way to sort of work all that, because I don't think, as Colleen said and put in her analysis, we don't necessarily have to include the language exempting certain religious institutions, but I think that the reason for that was just to make it easier about what the issue we're trying to address is, or that Representative Foster is trying to address.
Ms. Gardner, do you want to respond? You're on mute.
I'm not quite sure I fully understand the question, but I think at least in part it goes to one of the distinctions. I think you're correct, at least under 368, there's a pot of money that's put aside, and in the event that people are unsuccessful in more informally settling claims that might arise, then there's money set aside that can be accessed if you get a court order on a judgment. So you're unsuccessful settling your claim, it goes to court, court sorts it and gives an order, then that money can be accessed. Under Representative Foster's bill, and maybe he should speak to this, but what I think is one of the important distinctions is that at least the amount that's set aside is per vehicle that you want to essentially insure or alternatively insure through this method. So you've got that minimum pot of money per vehicle. And under 1063, it's a more similar amount of money that can insure multiple vehicles.
And I think it can go, as I understand it, go up to 250,000 because the more vehicles they insure, the more they would. And as I understand it, they're willing to go whatever would satisfy and help with you guys. Because as I understand it, they're just trying that in accordance with their faith, they don't want to be involved with. And I know you guys have worked hard on this. I know there's been a lot of discussions. I think they're grateful for that too. But I think they're trying to just figure out a way that, because I think, as I understand it, so to try and if they have 25 vehicles, they'd have to pay $175,000 for each vehicle they want to insure under 368. Okay, versus with theirs, they're looking to extra money for every so many vehicles or something along those lines.
Right, and seemingly, at least in my read of it, they could cover up to 25 vehicles with $175,000 put aside. And
sorry, go ahead.
Increase more vehicles. Apparently, with no actual cap that I see in the language, they could increase beyond that by adding $1,000 per vehicle to the pot, but then that's capped at $250. $250,000. But so $250,000 could be covering, if you will, the potential accidents for an unknown number of vehicles.
Right.
Again, I think in 1063, we also have the concerns that we had sort of with the CMP issue, is that there are a lot of things that we're supposed to determine if the solvency of the organization or the individuals, it's a little unclear, is adequate. There are some determinations like that we're charged with that, again, we're not really comfortable. We don't know how to assess solvency, particularly in a group of individuals, to be able to self-insure in this method. So it's a level of expertise that just isn't our baby, if you will.
Okay. Representative Tepler, go ahead.
Thank you, Madam Chair. I don't want to interfere too much in what Representative Morris is working through, but I was going to take us back to the conversation about CMP. So if that's relevant.
Go ahead. It's okay, go ahead.
Yeah, I was wondering whether or not the PUC currently puts out an annual report on the solvency of Central Maine Power that could be used by the Secretary of State's office, so that they don't feel that they are in the position of judging the solvency of the organization, and whether that's something we can just sort of refer to in the bill. And I guess that would be a question for Colleen to make a determination about.
Yeah, I can certainly look at that. I mean, I was thinking about along the lines of what Senator Sanborn added or suggested as her motion. If we do put language in there about allowing only a utility company that it could be drafted in such a way to say, you know, utility company regulated by the PUC that has financial standards that meet whatever cross-reference that we could include related to that issue. So that's the kind of along the lines of what I was thinking about for proposed language, assuming that motion moves forward.
Representative Evans.
Yeah, thank you, Madam Chair. I hate the fact that we're getting this so late, but I think that listening to all of the discussion, the path forward is in the motion that you made. And I think we should pursue that. So I would second that motion.
Thanks for the second, Representative Evans. I think we haven't, you know, the conversation we need to have right now is sort of about the difference and distinction between 368 and 1063 as it applies to sort of solving the Mennonites, you know, particular concern. And Representative Foster does have his hand up. He is the bill sponsor, so as a courtesy, I'd love to bring him in and get his thoughts on this as he's coming through the wormhole, and he's with us now, so he can probably hear that. I'll just sort of say, and it's probably what Representative Tepler and perhaps others are thinking, that, you know, and that I think Ms. Gardner may have even sort of intimated that, you know, I think the concern is that when the limits aren't tied to any particular individual or any particular individual vehicle, the coverage becomes something that sort of turns the Secretary of State's office into an insurance company in a way that they are trying to avoid becoming. And this whole thing sets up in 1063 would set up really a more complex insurance collection of premiums and insurance company type of structure. And so that's my concern with 1063 as opposed to 368. At least 368 is sort of one-to-one. Don't expect it to be used that often. And it's pretty straightforward and cut and dry, black and white, and therefore I think supportable, though perhaps unaffordable. And I can certainly understand that piece of it as well. Regrettably unaffordable, but maybe the only way to provide a way around this. So with that context, just so that Representative Foster kind of knows where I'm coming from and heard where Representative Morris's questions were coming from, Representative Foster, go ahead.
Thank you, Senator Sanborn, Representative Tepler, members of the committee. I am Steve Foster, representative for District 104. I certainly understand the concerns of the committee with this LD 1063. I would state that you know, we are willing to change this language in any way that's acceptable to the committee. For instance, it was mentioned during the hearing concerns about this particular religious organization, and again, as was mentioned by your analyst, the language was put in there to mirror what is in other states and also what meets federal exemption language for an organization such as this. That being said, my constituents are more than willing to raise the limit that I put in the bill, and just a rough idea for the vehicles, we'd be willing to go to say 250,000 the starting point, $1,000 per vehicle after that. And I will say, as far as claims go, and the concern about the Secretary of State's office becoming an insurance entity, if you will, basically this group has always operated, and they have years of history in other states with the idea that there are no claims, in that when they put the bond up, if you will, they don't touch that money. It's not something the Secretary of State or the State Treasurer would have to dole out, because they will meet the requirements for meeting claims on a case-by-case basis. If they should fail to meet a claim and a court finds against them, then that bond amount that's set aside would then be utilized to pay off the claims. And also, at that point in time, according to the legislation that I've put in, they would lose the opportunity for further self-insurance. And they, as far as I know, there's not been a case of that where that they have not been able to meet obligations where that's occurred elsewhere. So there would not be, for instance, a use of some monies from that bond and then a repayment. That would be one of the stipulations that would cause them to lose their ability to self-insure. I would also mention there were several issues raised, especially by the insurance industry in the hearing. But I would mention that one of the things that was a large concern was if there were multiple accidents or a large accident that where that there were court findings of a substantial amount. As with our own personal auto insurance that we have, there are limits to what the insurance company would cover. And at that point in time, for instance, my insurance, I have a higher liability amount. If the insurance company pays that off, then there's more findings than they provide. Then, of course, the courts would come after my properties or my funds. So that's not really that much different. Again, in most cases, these folks put up properties that they own for their surety bonds. So I certainly would appreciate the opportunity to work with your analysts and continue to work with Secretaries of State's office to find a common ground here where that they would be allowed to self-insure in Maine as they are in the other states that your analyst mentioned earlier. I would also touch on 368 briefly. I just came from EUT. We're having all kinds of bills this morning hearings, but one of the conundrums we find ourselves faced with is with ratepayers and your information you received on what that change in 368 would do to their bills. Likewise, when I was researching my bill, I found that the state of Maine, we self-insure our fleet. And what that means is claims are handled, I guess, on a case-by-case basis through that. If we decided that we needed to have auto insurance companies provide that coverage, then obviously we would be subjecting the state of Maine taxpayers to a greater expense, I would guess, than we do by self-insuring. So again, I'll just leave it that we're willing to adjust the amounts that are in my bill to something that's more appropriate. The limit, the bottom floor limit of 5 vehicles was to make sure that anybody wanting to do this, had a good reason to do so, that it wasn't just somebody that had 1 or 2 vehicles. And certainly, in most cases, those groups in the state of Maine have relatively few vehicles. I think over in Brownfield, they're up around 60 or 70 vehicles in that group. Thank you very much for your time and your patience with this.
Thank you, Representative Foster. Is there further discussion on the bill? Representative Quinn.
Thank you. I am in support of 10. I agree that if the state has some issues and wants to raise that amount, that would be acceptable. I do work with many of these communities, and they do their healthcare in the same way. I have never known them to not. This is part of their religious faith and religious belief that they would actually back on that. So that's just one of the reasons in which I'm doing that. But also, they're not accepting money from the federal government for other things as well. They have a clear-cut delineation of wanting to be separate in every aspect of their life. And I just feel that that's something that should be honored if we can do it in a way that's financially for the state and the communities involved. Thank you.
Other comments? Okay. Representative Arford, go ahead.
Yeah, this is just a process question. If, the request to continue to work on this bill with the Secretary of State's office and our committee, what would that look like? Would we, what would that look like from a process perspective?
Is that a question for Representative Foster?
I get for whoever has the answer to it, because I don't.
Representative Foster, go ahead.
Thank you, Madam Chair. From my point of view, I would certainly be willing to work with your analyst to craft an amendment to this bill, but I would certainly need to know from the committee, and I think during the hearing, you expressed some, various members expressed some concerns with the bill, but it would be good to know if there's an opportunity to change this bill where it might be acceptable, what items would need to be changed. I know there was some concern that it was referring to a religious organization. Certainly, it doesn't have to. It could be a nonprofit, could be just plain organization. And I will state that I think, as Representative Quint pointed out, there aren't very many nonprofits in the state that would take advantage of this bill because when it comes right down to it, if you're faced with paying out of pocket, if you will, for any damages in an auto accident, most of us would say, I would rather depend on my insurance company to do that. And I think most nonprofits would be the same way. So it is probably a very narrow window that this group or any other groups would look at in taking advantage of this bill. So that's what I would propose, that if your analysts had a better idea from committee members on what might be acceptable, I would work with her to craft amendment to an amendment to this bill. Thank you.
Are there further comments from the committee? Representative Tepler.
Thank you, Madam Chair. And I want to be clear, with all due respect, Representative Foster, I can't support this bill. I think the burden that it places on our Secretary of State's office to provide a replacement for the sort of responsibility that goes with individual owners and individual vehicles is complex and potentially problematic. The counter proposal that maintains that individual vehicle, individual owner that the Secretary of State's office is more comfortable with makes much more sense to me. And I think there are a lot of concerns around making the Secretary of State's office responsible for maintaining communal responsibility in place of insurance.
And just from a procedural perspective, I will say, I don't think that there's any reason that we couldn't have a report on both of these two bills, as I suspect that the committee is not in consensus on both bills. But I think that we could have both bills, and I don't think voting in favor of my motion on 368 necessarily precludes also voting in favor of 1063 if somebody wanted to do that. So that's my sense of the matter. Representative Morris, you're welcome to weigh in on that procedural.
No, thank you, Madam Chair. I would, yes, sorry. Thank you, Madam Chair. No, I would agree. I think I as Representative Quint said, I too support 1063, but I don't think that means I necessarily have to vote against 368 myself. I think, and again, I do want to say, I do appreciate Secretary Bellows and the Secretary of State's office for working, and I understand their concerns on it. But I do think, I also know how hard Representative Foster has worked on it, and I know what makes me feel more comfortable with it from my perspective is just the fact that I know it has been done in other states and seems to be working. But again, I certainly understand the concerns of you and others on the other side of this issue.
Yeah. And I will just say I received quite a lot of communication with concerns about 1063, which is a bit unusual. You know, I was a little bit surprised by that, but I will also say that I do worry. The reason I like 368 as the solution to this problem is because if we're talking about individuals who wish to be treated in a certain way or not participate in insurance because of their faith, then I think we have to treat them as individuals in that way, as opposed to sort of recognizing them as a collective of individuals who wish to not participate in something that the government is requiring of them. And so I get a little twisted up in sort of recognizing that, you know, as Representative Quint said, I don't in any way, you know, have concerns that this particular group of folks is not going to pay their bills. That's not my concern. But my concern is singling out this particular group of folks and giving them sort of a pass, and setting up a whole alternate system that then also has to be potentially available to other groups of folks who could band together and create a similar situation, or else we're setting up just a very strange exception process that it isn't something I want to see really enshrined in our statutes. So that's my sort of the root of my discomfort with 1063, and why I think 368 is the only solution I know of for solving this particular problem, even though it's not as viable perhaps a solution from a financial perspective. And I do appreciate that problem with it, but it's the only one that I can arrive at to solve the issue. So is there further discussion on the bill, on the motion? We have one motion on the table, is there any further discussion on that motion before we vote? All right, seeing none, the clerk will call the roll.
Yep, this is ought to pass as amended on LD 368. Representative Quint.
Thank you. Can you come back to me, please?
Sure. Representative Connor. I'm sorry, can you unmute your mic?
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Millerano.
Yes.
Representative Millerano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. Representative Quint.
Thank you.
I'm sorry, you cut out there. Could you say that again?
Yes.
Representative Quint, yes. That is 12 yes, 1 absent.
Okay, and next I'll entertain a motion on LD 1063. Representative Tepler, do you want to make a motion on LD 1063?
Sure, Madam Chair. Thank you. I would move ought not to pass on LD 1063.
Okay, is there a second? Representative Matheson has seconded the ought not to pass motion. And is there further discussion on LD 1063? Seeing none, the clerk will call the roll.
Representative Quint. Representative Quint, no. Representative Connor.
No.
Representative Connor, no. Representative Blyer.
No.
Representative Blyer, no. Representative Morris.
No.
Representative Morris, no. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Millerano.
Yes.
Representative Millerano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That is 8 yes, 4 no, 1 absent.
Great. Okay, so it is now 12:12.
Can I just ask, I'm sorry. Can I just ask for the minority report?
yeah.
Did you want to make changes to the limits or just keep it as is? Or,
Just keep it as is.
okay,
Just
thank you.
keep it as is. Yep.
All right, so it's now 12:12. My caucus at least has been going since 8 a.m. So we are going to take a break to continue going on Zoom probably, but in a different window. But I just, so the participants, we do have 65 people on the Zoom call right now. So everybody get out your pencils. I'm going to tell you the order of bills that that we're going to pick up after lunch, at least the tentative order. Don't hold me to it, but this is the plan as I have it laid out in front of me. First, we will pick up the car sharing bills, which are LD 540 and 1420. Then we'll pick up LD 750 and 751. Then we will pick up 1036, then 1085, 1150, 1331, 1196, 1258, 1266, 1268, 1293, 1311, 1317, 1450.
We postponed 1317.
Oh, not 1317, that was postponed. So after 1311, we would pick up 1450, then 365, and then 1544. And obviously that's a lot to do this afternoon. It's also a lot that folks may need to continue to talk about over lunch. So it is quite possible that one or more of those could get sidelined at some point in the process, but just so folks have a sense of what we're planning to get through this afternoon, and we'll try our best to do. So with that, I think we will reconvene at 1:45 to allow everybody to have lunch and continued caucus over lunch. Does that time frame work for you, Representative Morris?
Yes, it does.
Perfect. Okay, so we will reconvene at 1:45 and eat some protein, everybody, so we can get through a productive afternoon. I'll see you at 1:45.
Can you do me a favor? I'll run down and get it myself. I wish we could send this to her now, though.
Not to enjoy coming back online. I'm not sure who's here. Are any of the Republicans with us? Yep, great.
Yeah, we should all be here, Madam Chair.
Okay, great. And we're filing in, I think, on our folks as well. Okay. Let's get a couple more people to be here.
I feel like you need to.
We'll pick up our LD 540 and LD 1420, and we'll have Colleen do a presentation. And also, Colleen, has the Car Sharing Model Act language been circulated in its most recent sort of iteration to the whole committee?
Yes, yesterday
Okay.
it was circulated by email and it's uploaded now onto the electronic LD file, and it says revised proposed amendment.
Okay.
And I can also share it if you need it, but yeah.
Okay, perfect. All right, I'll have you go ahead and do your presentation.
Okay, so here we go. I did do these together, even for purposes of the bill analysis, although they take different approaches with regard to the issue of vicarious liability. Both bills propose to make changes to our current law that regulates peer-to-peer car sharing programs. LD 540 contains one provision. It would repeal the provision in current law that provides an exemption from vicarious liability for persons facilitating peer-to-peer motor vehicle sharing and owners of the motor vehicles. LD 1420, on the other hand, is proposed to make changes to conform Maine law to the most recent version of the National Conference of Insurance Legislators Peer-to-Peer Car Sharing Model Act. And as Senator Sanborn noted, Senator Stewart, who's the sponsor of the bill, had me share revised proposed amendment, sort of amending Maine law based on the model that was prepared by the proponents of LD 1420. Committee members who served on the committee in the 129th legislature will remember that this legislation, the current law that regulates peer-to-peer car sharing programs, was first enacted in the first regular session after consideration of LD 1615. You also still, even though I didn't include it here, included or considered legislation last session, LD 2027, to make some further clarifications and changes to the current law. That bill, while it was voted by the committee, ultimately after many work sessions, was not fully considered by the legislature because of the failure to come back into a special session after July. A couple of things that the Bureau of Insurance noted, and I guess I would highlight here, that sort of the couple of the substantive changes to current law, if you did move forward to conform more closely to the Model Act language in LD 1420, there is a requirement in Maine's current law that program providers procure comprehensive and collision coverage for rented vehicles. That would be eliminated under the Model Act. This is a requirement that was developed by the committee as part of your discussions of LD 1615 originally, and it does appear to be unique to Maine of the states that have enacted legislation on peer-to-peer car sharing. But it does fill, I think in the committee's view, when this was developed, is intended to fill a coverage gap, potentially. And then secondly, the current law requires program providers to procure insurance to cover a driver's liability in an amount that's equal to 3 times the minimum limits under the financial responsibility law, under the Model Act, and as proposed in LD 1420, that would change those requirements for liability insurance, and they would be lowered to the minimum limits under Maine's financial responsibility law. And then, as I noted in summarizing the 2 bills, they do take different approaches to this issue of vicarious liability. LD 540 would repeal the provision in current law that provides an exemption. LD 1420, as revised, would maintain the exemption that's in current law. It doesn't make program providers vicariously liable, but other provisions of the Model Act would require them to assume liability by contract in an amount equal to those minimum limits under the financial responsibility law. A couple of technical issues that the Bureau of Insurance noted in their testimony with regard to LD 540 is there are some potential contradictions in current law as to the liability of the program provider for damages caused by the renter, and they've suggested that the committee might want to consider clarifying the language on that point. I think particularly if LD 540 is not adopted as drafted, I think if the policy choice is made by the committee to remove that exemption for vicarious liability, that makes things clearer. They also suggested that if LD 540 is not adopted as drafted, you might consider sort of correcting some current law cross-references. There's a cross-reference to a provision in Title 29A that has been preempted by federal law in a court decision, so it might make sense to remove that specific reference. You did have some suggestions that if the committee is interested in considering changes or revisions to current law that would adopt the Model Act, that you allow for further consideration and discussion among a stakeholder group. And then we don't yet have any fiscal information on these bills. I did note that the committee did have considerable discussions last session about LD 2027 to make some changes to the current law. Those changes are not specifically embodied in LD 540 or LD 1420 as revised by the sponsor. So if the committee is interested in sort of revisiting those, I'm happy to share that. The language of, as you considered LD 2027, if you're interested. And then I would just note that you have several folks in the room who could respond to your questions about the proposals.
Thanks, Colleen. So I will just sort of mea culpa a little bit in that I think, we engaged in a pretty lengthy stakeholder process to try and pass our first peer-to-peer car sharing bill. 2.5 years ago now, that I spearheaded. I think we made a mess of it. As the Bureau has pointed out in their testimony, we have contradictory statements. We've got requirements for financial responsibility resting with the Secretary of State's office that they don't want and don't understand how to deal with. We have requirements to buy certain kinds of coverage that don't exist. It is real bad. And it's been made worse, I think, by our failure to be able to revisit it over the last year during the pandemic, because we didn't pass any kind of cleanup bill last year. So it's a mess. And so I think that the right way forward is to sort of wipe the slate clean and pass LD 1420, which is a model act, simplifies things and clarifies things. And I think importantly, it also levels the playing field and sets a level playing field so that whether you rent a car through a large multinational corporation like Avis or Hertz or Enterprise, or whether you rent from your neighbor through a platform like Turo, the liability landscape that you face is basically the same. So I'm just trying to lay out kind of a little bit, and I do take some responsibility for like real bad lawmaking, and I'm hopeful that we can kind of fix it by clearing the decks and starting over with LD 1420. So I would move ought to pass as amended with the most recently revised and posted amendment in our LD file. Is there a second? And then we'll obviously continue to discuss. Representative Morris has seconded it, and Representative Tepler, go ahead.
Thank you, Madam Chair. I will not be supporting this bill unless we are willing to remove the Graves Amendment from the bill, which would be Section 2.5, which would create vicarious liability responsibility on the part of the car sharing app, because I don't think that we need to enshrine in state law this sort of tort reform, which prevents people who are third parties from having their medical bills paid fully. And it allows for a company to really limit their liability and leave somebody else to pick up the mess if there is a problem. And I don't think that's a good idea. And yes, rental car companies by federal law have that ability, but I don't see why we need to take a law that's federal but doesn't apply in this case and enshrine it in state law. And I also want to point out that as Mr. Yardley's testimony indicates, Oregon, Washington, and California place liability for accidents caused by renters on the program providers. So we would not be the only state that required vicarious liability for the car sharing app. And I think that's something we need to think about, and I will not be supporting the current motion.
Okay. Are there additional comments from the committee? Okay. Representative Arford, go ahead.
I just wanted to state that I also will not be supporting this motion for basically the same reasons as Representative Tepler.
Okay. Does anyone else want to comment? Representative Morris.
Thank you, Madam Chair. I will be supporting the current motion. I think it is appropriate to bring it into a level playing field with other rental car companies, as it were. I know this is a little different, but I can tell you my brother rents cars all over the country. I've rented as well. There is no vetting of people when they are renting cars anywhere. They just want your driver's license in your credit card. I think this is a good step. I think this is a good direction to go into fix and make it as much in line with what the Model Act would asks for, if for no other reason than to ensure that the people of Maine have an opportunity to participate in this gig economy and in this sharing economy. So I will be supporting the motion.
Representative Evans, go ahead.
Okay, thank you, Madam Chairwoman. Just to follow up with Representative Morris, you will be supporting with section 2.1 still in?
I am supporting the
2.5.
Yeah, that's the motion, Representative Evans, and he's supporting the motion. Yeah.
Okay, thank you.
Yep. I do have some additional, we can get some additional information about the California, Oregon, and I don't remember what the other third state was. If anybody wants to know more about that piece, it's a little different than just taking out the Graves Amendment. So does anyone want more information about those other states? No. Okay, great. Let's not do that then. Representative Evans, you still have your hand up. Do you have another comment? Okay. Does anybody else want to comment on this? All right, seeing none, I think we're ready for the vote. Oh, Colleen, go ahead.
I just want to comment briefly that I will have to make some extensive changes to the draft, the revised draft, just to put it into, not substantive changes, but it'll have to be reformatted and, conform to Maine's drafting standards. The other question that I had about it from a technical perspective is it proposes an effective date of April 1 of 2022. But I'm wondering what happens if that's agreeable, or if there should be some earlier date if we're going to transition to the model, if it should have a shorter time frame for those changes. So those are my only questions about the revised draft.
Yeah, that's a fair question, and unfortunately Senator Stewart's not with us, and he would be the sponsor of the amendment, so I'm not sure how to respond to that.
I'll just flag it, and maybe that's something we can come back to for language review. But.
Yeah, I think that's appropriate on language review because I'm not sure it's super substantive, but I also don't know why the drafters chose that date at all, and I'm a little puzzled by it myself. So I don't
either. So I didn't have a chance to follow up. So I just wanted to flag that one thing for you.
Okay. I'm fine with dealing with that on language review unless anybody on the committee objects. Okay, let's do it that way. Thanks, Colleen. Are there any other comments before we take the vote? All right, go ahead, Christian.
Representative Quint.
Yes.
Representative Quint, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
No.
Representative Arford, no. Representative Millerano.
No.
Representative Millerano, no. Representative Brooks.
No.
Representative Brooks, no. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
No.
Representative Tepler, no. Senator Sanborn.
Yes.
Senator Sanborn, yes. That is 8 yes, 4 no, 1 absent.
Okay.
What would the minority report be, Representative Tepler?
The minority report would be accepting the NCOIL model as revised. So that minus section 2.5, which
just
is
with that taken out. Okay.
Yes.
Thank you. Yep. Thanks very much. So the only difference between the two reports would be that subsection.
Vicarious liability section.
Great, thank you.
Thank you.
Okay. Representative Tepler, the other bill that we need to look at is LD 540. In light of what we just did, what would you like to do with LD 540?
I am willing to vote ought not to pass on LD 540, given that my report on 1420 covers the issue, and 540 was directed at the original bill, which is a mess in other ways. So I am willing to have that go ought not to pass.
Okay, great. Is there a second? Representative Connor has seconded the motion ought not to pass on LD 540. Is there any additional conversation? All right, seeing none. Go ahead, Christian.
Representative Quint.
Yes.
Representative Quint, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melarano.
Yes.
Representative Melarano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler. Could you unmute?
Oh, I'm sorry. Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 12 yes, 1 absent.
All right. And next we will pick up LD 750.
Okay. Want me to share? Go through?
Yep.
Okay.
Go ahead.
LD 750 is an act to increase transparency of and lower healthcare costs. This was a concept draft sponsored by Representative Morris, but he provided amendment language in advance of the public hearing. And so you took testimony on the proposal as amended. It would make some changes to the current law that relates to what we call the right to shop program, but what in statute is called the Comparable Healthcare Incentive Program. It would remove the requirement that small group health plan design be compatible with a health savings account. It would require that incentives must be equal or greater than 25% of the difference between the price that the provider utilized and the statewide average for the same service. Based on data reported on the MHDO website, it would add to the categories of healthcare services included in the definition of comparable healthcare service surgical procedures, and it would repeal a sunset date in the current law of January 1 of 2024. Under current law, which was enacted by the committee at the end of the 128th legislature, if an enrollee under a health plan other than an HMO plan elects to obtain a covered comparable healthcare service from an out-of-network provider at a price that is the same or less than the statewide average for the same covered healthcare service, the carrier shall allow the enrollee to obtain that service from the out-of-network provider at the provider's charge, and upon request by the enrollee, apply the payments made by the enrollee for that comparable healthcare service toward the enrollee's deductible and out-of-pocket maximum, as if the services had been provided by an in-network provider. The bill as amended, Representative Morris's amendment would remove an exception that the provision does not apply to health maintenance organization plans. And there's a further limitation in the current law that defines an out-of-network provider as a provider located in Massachusetts, New Hampshire, or in Maine that's enrolled in the Maine Care program and participates in Medicare. The sunset date of 2024, January 1 of 2024 for this provision is also repealed in LD 750. I wanted to point out that the current law that was enacted does include a reporting requirement by the superintendent of insurance that began in March 1 of 2020, and it's an annual report. Requires the superintendent to evaluate the incentive programs that have been created by carriers um, and submit an aggregate report regarding the use of incentives, the incentives earned by enrollees, and the cumulative effect of the programs. The first report was submitted by the Bureau of Insurance in August of 2020. And that was shared with the committee previously, and there's a link here, but just sort of some of the highlights from the report. Of the 7 carriers that were surveyed for 2019, only 3 carriers reported issuing incentives. 19,978 enrollees were enrolled in HSA compatible small group health plans that included incentive program as part of it. 82 enrollees of that number received incentives, and a total of 115 incentives were issued, totaling a little under $6,000 in the aggregate. 67 incentives were for radiology and imaging services, and 38 were for lab services, and then a lower number were for the other 2 categories of services that are recognized. One of the issues that was raised and is proposed to be removed in LD 750 is that the current law only applies to those who are enrolled in HSA compatible plans. So it's suggested that the option be available to all consumers. And then additionally, the types of service that are eligible for incentives are limited under the current law. LD 750 would add surgical services, and some folks who testified at the public hearing suggested broadening that even further and consider adding additional services. The other thing of note to remind the committee, and we've talked about this before, is that there are federal rules that will now be going into effect requiring fully insured and self-insured plans to disclose information about their negotiated rates and provide cost calculators that will provide the expanded ability for shopping, if you will. The requirements in the federal rules apply beginning in plan year 2023 with a cost calculator that carriers must provide for a minimum of 500 shoppable services. And then I mentioned the provision in current law that limits or sort of defines the scope of what an out-of-network provider is. You did hear some testimony, and the bill as proposed would take this language out. You did have testimony from representatives of physical therapists and direct primary care providers in support of this change. And then lastly, sort of as a technical issue, there's some language in the proposed bill that would remove the applicability of the section to HMOs. I think the Bureau of Insurance noted that it's not necessarily compatible with how HMOs function, and they don't normally provide coverage for out-of-network services, as they limit coverage to those who are part of the network. So that's a technical change I think that the committee might consider if you move forward with the bill as proposed. And I'll stop there, and I'm happy to answer any questions that you have.
Thank you, Colleen. Okay. So comments or questions for Colleen? I will comment if no one else will. So I will comment that, again, there's a lot of history here. I was involved back when Senator Whittemore brought this bill in my very first term in the legislature. I feel like we just keep going over the same ground sometimes. Colleen probably feels a lot like that, having done this for a couple of decades. But was part of passing this bill, was hopeful that it would provide some value to consumers, even though I didn't think that it would revolutionize the health insurance landscape. And read the first report that came out a few months ago with great interest. I remember opening it on my phone and reading it and going, "Are you kidding me? Only 81 people use this thing." Yeah, okay. I guess it didn't hurt anybody, but it certainly $5,000 I don't think was what Senator Whittemore had in mind when he sponsored this bill in the first place. So my immediate thought, and when I saw the report, was perhaps we should move the sunset up and make this shopping incentive program no longer be on the books. So I am inclined to not double down on a concept that is not working. and instead to vote ought not to pass on LD 750. So that's what I would make as a motion. Is there a second? Representative Brooks has seconded the motion, but there is plenty of time for further discussion should the committee want some. Representative Morris, go ahead.
Yes, thank you, Madam Chair. And I don't want to belabor this. I know we're all kind of where we're going to be. I do understand how hard you worked on the issue, and I know it's we all would like it to work. I think part of the reason why we had inserted in the language to require more savings to be passed along to consumers was because of that issue, trying to get more utilization out of it. That's part of why we had that inserted in the language in the hopes that instead of them just offering a $5 gift card, they would instead offer more incentives. But again, I understand that you worked very hard on this a few terms back and probably are ready to move on to trying something else. But I will still be supporting the bill, but I thank the committee for the consideration.
Thanks, Representative Morris. And I do appreciate that and certainly thought about that as well as you raised it in the bill. I just don't think that consumers use their health insurance that way. And I don't think that health insurers advertise very well to consumers. We don't really want to hear from them either, potentially. So we sort of block out some of that information, and then we don't use those types of, you know, lower cost providers or incentives in that way, unfortunately. I wish we did. We just tend not to. Any other comments? All right, I will have Christian call the roll.
Representative Quint.
No.
Representative Quint, no. Representative Connor.
No.
Representative Connor, no. Representative Blyer.
No.
Representative Blyer, no. Representative Morris.
No.
Representative Morris, no. Representative Matheson.
Oh,
I can't hear you.
Not audible. We may have to come back to you. May have to leave the Zoom and come back, Christy. Okay.
Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Millerano.
Yes.
Representative Millerano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 7 yes, 4 no, and 1.5 absent.
We'll pick up her vote while we're still on this call, so she won't have to lodge it with the presiding officer. She's coming on back.
Is the minority report would just be ought to pass as amended with your original amendment, Representative Morris? Okay.
Yes.
Great.
Yep.
Great. Representative Matheson, are you able to unmute now?
I think so. Can you hear me okay?
We can. Go ahead.
Great. Could you repeat what I'm voting on, please? I apologize. Would you repeat that for me, Christian?
Yep. The motion is ought not to pass on LD 750.
Yes, thank you.
Representative Matheson is yes. That is 8 yes, 4 no, 1 absent.
All right, perfect. Thanks, everybody. All right, so the next bill is LD 751, and we'll have Colleen do her analysis.
LD 751 is another bill that started its life as a concept draft that Representative Morris sponsored, but he did provide language before the public hearing, and so you took testimony on this language. The bill would expand the scope of loss information that must be provided to an employer to facilitate an employer shopping for group health insurance coverage. It would add to the current requirements some specific sort of minimum information that must be provided when a request for loss information is made. It would state that a minimum 24 months of claims data, or if that period is less than 24 months, claims data for the period the policyholder, former policyholder or school administrative unit has been insured with the insurer. Loss ratio by month with medical and pharmacy claims identified individually. Reports on high cost claimants that coincide with the timeframes of any loss ratio reports provided, and information describing pre-certification requests for hospital stays of 5 days or longer that were made during the 30-day period preceding the date of the request for loss information. As I mentioned, there are some requirements in current law already that mandate an insurer to provide loss information upon written request concerning a group policy or contract to its policyholder, to a former policyholder, or to a school administrative unit within 21 business days of the date of the request. An insurer is not required to provide this loss information to a small group of 50 or fewer, as these groups are community rated, not experience rated. As drafted, LD 751 would change that exception so that an insurer would not be required to provide loss information to a group that's currently rated as a small group and will be renewed with small group coverage pursuant to current law. And in other words, for a small group that is currently community rated and will remain community rated, the insurer is not required to provide that information. But the bill would allow small groups and groups of larger size to get the information that's specified in the bill. The information would also not be required to be shared if the insurer is otherwise prohibited from sharing the information under federal or state law. That's an additional clarification that's made in Representative Morris's proposed language. You have received some concerns about the potential for release of an employee's personal medical information through the authorization for sharing information about high-cost claimants. The sponsor did indicate that the intent is for de-identified data to be shared, and the language in the proposed bill is to authorize data to be shared directly without disclosure to the employer. So it would sort of be from insurer to insurer, or from insurer to an insurance broker or producer. The language as drafted also requires that a group policyholder receiving that information should take all precautions and actions required under federal regulations with respect to privacy and security of protected health information. So if the bill does move forward, you might consider whether the bill needs sort of further clarification about compliance with HIPAA, which I think would allow some release of de-identified or aggregate information. As drafted, the language describes what a high-cost claimant is as someone with claims in the aggregate that exceed $20,000 over a 12-month period. You did have some suggestions in testimony that the committee consider a higher threshold, perhaps $50,000, or maybe consider claims on a sliding scale based on group size. And as drafted, the language, as I mentioned, would require disclosure of the loss ratio by month with medical and pharmacy claims identified individually. It was suggested that the committee might consider a longer time frame for providing that loss ratio information, perhaps quarterly. And the language of the bill as drafted also would require prognosis information as well as primary diagnosis information about high-cost claimants. Carrier representatives suggested that information about prognosis is not something they typically would have. So consider whether the reference to primary diagnosis information would be sufficient. And then with regard to the requirement for sharing information about pre-certification requests, carriers suggested that that type of information is beyond what they might typically provide for folks looking for this type of loss information, and it seems burdensome. We don't yet have any fiscal information about LD 751 if it moves forward. And I guess I will stop there. I'm happy to answer any questions or provide any additional information you might need if you want to look at the current law or pull up the language of the proposed amendment.
Okay. Are there comments or questions for Colleen? You guys are making me do all the work here. Representative Morris, thank you. Go ahead.
Yes, thank you, Madam Chair. So, as you know, this was my bill. I have been, unfortunately, Joel had to hop off for another call but I did have a chance to chat with him as well as Chris Ossenforth the last few days, trying to clear up some of the issues and so forth. And I think We do want to specify that, yes, this does not apply to small groups. This is people that whose it's experience rated, where small groups are usually community rated. So we want to make sure that that is clarified in the language. Also, I think the issue on prognosis is if known. So if they know the prognosis, because as I understand it, they'll usually ask for it when they, and sometimes it is known. So I think the idea on that is if known, and as far as some of the other amendments, and the other discussion to have is obviously over the $20,000 versus the $50,000, and I would certainly entertain where the committee would like to go on something like that.
Are there comments from the committee on something like that? Is anyone listening? Okay. So, you know, I definitely don't want this to apply in small groups. That was a big red flag for me. Even though I have been very public about the fact that I'm one of those non-community rated small groups. So I had, you know, this theoretically would help me shop around for coverage, but it's information that I should not have at all, because I'm too small a group to have this type of detailed information about my employees. So that piece was a big red flag for me. The other piece of it is the whole high cost claimants analysis piece for me. I did have a conversation with somebody who explained to me that from an insurance company who explained it actually could work to the benefit of the group. It could work to the benefit of the employees if they knew, for example, that the reason for the high cost was something that wasn't likely to be repeated, like a car accident with a, you know, leg surgery or a C-section or something like that. But we also heard from Steve Butterfield, who just had real big concerns that this could be used to ensure that folks with chronic or serious disease, you know, just wouldn't be able to have coverage that was appropriate for them through their employer. So that all of those different things taken together threw up enough red flags for me that I just felt like I didn't want to support this bill. You know, even if it was amended, because I didn't feel like the benefit for it was worth the risk. There were too many trade-offs that were involved with the information that was being required by the bill. So that's kind of where I land, even though some of your amendments have addressed some of those pieces. I think that it starts to peel back to the point where we're kind of left with our original law that's already in the statute, which does require that claims information be made available for the purpose of shopping large group coverage to a different carrier. So I don't think we're hearing that anyone is completely shut out of being able to shop their plan to other carriers. And I don't know how much information we really need to, how much detail we should be providing for this. So that's kind of where I landed on it. Representative Morris, go ahead.
Yeah, thank you, Madam Chair. I think, you know, the other piece on this too is, as I said, you know, we're certainly fine with moving that up to the, for high cost claimant up to 50,000 for the reasons that you mentioned as well. And I think the exception under 4, this language is provided to us by Chris Austin for it, is to have it say an insurer is not required to provide the loss information described in this section for a group that is eligible for small group coverage pursuant. So even though you may not be, you may be in your shoes, but you would be, because you're eligible for small group coverage, you would be accepted out of this.
Right, which is what's in the current law. That's what
Okay.
main law is today. Yeah.
Well, and that would continue with this, because I think there may have been some confusion in how it was drafted to continue that. Because I think the other piece of, as I understand it, is that when they, when large groups in particular are trying to find new coverage, these are questions when they're trying to shop their plans to see if they can find a better plan. These are the questions that are regularly asked that they are not required to provide. And this would require the information to be given because, and again, it can move from underwriter to underwriter and be depersonalized. And the idea of it is so they can find a better, they can potentially find a better rate. And I think it helps too when you think of a lot of some of the large groups that we have in this state that buy insurance are some of our school systems and things of that nature. And if we can do this and they can potentially shop for and find better plans, I think it helps the employees of those places as well as our taxpayers. So I think that that's the other reason, that's another point that I would just like to bring up, because this information is asked for, and the trouble with it is that even though it doesn't belong to the insurance company, I mean, they're the ones that have the information. I understand why as an employer you would not want the information, but it's technically it's the employee's experience. It's the employer's experience. It's not the insurance company's experience. So we're trying to help that employer find better coverage is what
Yeah,
we're
no,
looking
and I understand definitely Representative Morris where you're coming from. We just already have a statute on the books that requires that claim experience be shared, and it's just not as specific about what has to be shared. And I felt a little bit uncomfortable with the level of detail that was specified, and so would rather kind of rely on sort of industry standards, I think, that are already kind of implied in the current statute. And at least until we get more information or more assurance that it isn't used, for example, in plan design. I think that was Mr. Butterfield's concern that I don't think has been addressed, whether someone might actually use it to design a plan that could be priced lower, but also exclude the very treatments that a particular person with a particular illness or prognosis on the staff had at that particular employer. So I think that's the source of my concern, and the fact that we already have a statute on the books that ensures that some claims data and just sort of says claims data, I think, right, Colleen? Does that just says claims data has to be provided to the employer so that they can shop around. I felt like that was adequate, what we have for our current statute. Colleen?
No, that's right.
Okay.
What you said was right. Yeah, you're correct.
Okay. So I'll move on not to pass. Is there a second? Representative Tepler seconds, and certainly any other further discussion. If anybody else wants to jump in, don't all talk at once. All right. Then Christian can call the roll. Oh, Representative Arford with the late hand raised. Go ahead. You're on mute. You're still on mute.
Before we move on and vote on this, because I will be voting not to pass, but I just want to recognize Representative Morris, because he's working clearly very hard to bring down the cost of care for businesses and for individuals. And although some of us might not agree with the policy and the specific action, I think, you know, your hard work at this is to be recognized.
All right, great. Christian, go ahead.
Representative Quint.
No.
Representative Quint, no. Representative Connor.
No.
Representative Connor, no. Representative Blyer.
No.
Representative Blyer, no. Representative Morris.
No.
Representative Morris, no. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes. Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 8 yes, 4 no's, 1 absent. I'll let Colleen clarify the minority report.
Yes,
You wanna
ought to,
include those changes? Yeah.
yes, ought to pass as amended with prognosis if known.
Yep.
I suppose we can move up the claimant. Yep, and as well as just clarifying that if they're eligible for small group coverage, that they, exactly, yep.
Yep, great, thank you. Got it. Thanks.
Great. So we'll move along to LD 1036 and we'll have Colleen present the bill.
Okay. Really quickly, LD 1036. This was a bill that relates to eligibility for participation in the state's group health plan upon retirement. The bill would authorize a person participating in the state's group health plan who becomes eligible for coverage through the federal military health insurance program to decline coverage and re-enroll in coverage at a later date. The bill clarifies that the person remains eligible for coverage under the state's group health plan as a retiree and applies similar conditions for re-enrollment that currently apply to certain retirees that are eligible to re-enroll in coverage. Under current law, in order to be eligible for coverage under the group health plan, as a retiree must have participated as an employee in the group health plan for at least 1 year preceding retirement. And there are some certain conditions that apply. In addition, for those employees first employed after January 1 of 1991, the determination of how much the state pays towards the retiree's health premium is based on the number of years the employee participated in the group health plan prior to retirement. It's not based on their years of service as a state employee. If a retiree has 10 or more years of participation in the group health plan prior to retirement, the state pays 100% of the retiree share of the premium. For those employees who were first employed on or after January 1 of 2011, the retiree must have 20 years of participation in the group health plan in order for the state to pay 100% of the premium. And for those retirees that have years of participation that are less than those 10 and 20 years that I mentioned, the corresponding share that the state pays towards their the retiree share of the health insurance premium is reduced from that 100%. You had testimony from several state employees who also serve in the military that they are maintaining individual coverage in the state health plan while enrolling their families in military coverage just to maintain eligibility for the health plan in retirement. They noted that the premiums are less under military coverage and felt that the state could save money on the portion of the employee's premium if these individuals were provided an exception to re-enroll upon retirement. As I mentioned, the bill would allow eligibility to these employees, to decline coverage and re-enroll under certain conditions. The employee must demonstrate that they were covered under military coverage for at least 18 months immediately prior to their re-enrollment. And the election that they can make to re-enroll is limited to once only, and it must be made either upon termination of their eligibility for coverage under a federal military health insurance program or at the time of their retirement. And then there's further language that if a spouse or dependent of the employee was enrolled in the plan at the time the employee withdrew, that the retiree may re-enroll the spouse or dependent if they too meet that 18-month coverage criteria. I did want to make you aware of an additional bill that's being considered by the Labor and Housing Committee that also relates to availability of health insurance coverage and would make changes to the ability of retirees to make an election to enroll their spouse and dependent. That's a bill that's being heard, I think, tomorrow in the Labor and Housing Committee. But as it's drafted, that bill would allow retirees who are rehired by the state following their retirement to make an election upon their rehiring or during any declared open enrollment period to enroll a spouse or dependent in coverage under the group health plan for state employees. So it's a different issue, but it proposes to make some changes to the eligibility requirements in section 285, which governs eligibility for the group health plan for both active employees and retirees. We don't yet have any fiscal information about the potential impact of LD 1036 if it moves forward. I'll stop there and I'm happy to answer any questions.
Thank you. Colleen, Representative Tepler, go ahead.
Thank you, Madam Chair, and thank you, Colleen. I actually don't have any questions. I think this sounds like a good policy. I really don't have any problems with it and would support the bill. If it does have a fiscal impact, it will be up to the AFA committee to decide whether or not it moves forward. So it's more our job just to figure out the policy concern and let them worry about the cost.
Is that a motion, Representative Tepler?
Well, I was going to make a motion, but then I see that Representative Connor has his hand up, so I didn't want to step on his toes.
All right. Representative Connor, go ahead.
Thank you, Madam Chair. Thank you, Representative Tepler. I appreciate that. This bill is actually it's very important for me, obviously being a retired military member, but I don't know state government enough to know. So this is kind of a general question to the committee that I would like to get the answer to. I couldn't find it in my research. As a state employee, they're contributing to their health care for retirement. Is that a correct statement in general? So as a state employee, you're contributing every month to your insurance, and that goes into your for retirement. Is that what that is for?
I think we have an answer to that from Anya. So let's bring in Ms. Trundy to answer that. She may know.
Yeah, my understanding is that is not the case. You don't sort of prepay for health insurance in your retirement, but you pay on
not necessarily a prepayment, but it's going into a general fund, if you will, that will eventually be drawn on by all of the retirees. Is that how it's operated?
Oh,
good afternoon, Ms. Trundy. Maybe you can address this issue.
Yeah.
Good afternoon. Thank you. It doesn't work exactly that way. I mean, I think what you're kind of thinking of is kind of, like what the federal model is for how we fund Social Security and Medicare. But what I will say about it is the presence of the active state employees who are younger, and then as a product of that, typically healthier, their presence in the pool is in some way subsidizing the retirees that are in the pool, because it's bringing down the overall risk of the pool. So that is part of the reason that that the state employee health plan, the retirement eligibility is based upon participation rather than years of service.
Okay, thank you for that. I appreciate that. My only concern is that we're having members that are state employees that are not contributing to the plan. They're using TRICARE or the federal plan, and then later on, when it comes into the retirement years, they're going to be utilizing the healthcare services that they have not been contributing into. Is that a correct way of looking at it, or am I looking at it completely wrong?
I don't think you can entirely say that they haven't been contributing into it, because it's not like they're paying in for a benefit that they're then going to collect on in retirement. It's the fact is that their participation is managing the risk of the entire pool, that as a younger employee, you're not going to draw upon to the same degree, whereas as as an older employee and a retiree, you are more likely to draw on that. And, certainly, one of the things that we see is that, and one of the fun facts about the state employee health system is that 1% of enrollees account for 31% of expense. And if you look at a distribution chart of how expense skews over the course, the expense is much lower when you're talking about 20, 30, 40-year-olds. But as you start to get into your 50 and 60 plus year olds, that would be, the pool who are special plan retirees, they have the expense starts to mount.
Okay, so with this bill, if, like you said in your words, the younger employees or the less likely to use the services is not contributing in, then the state, the fund is actually losing money. Is that correct? Or losing the potential for that younger person's dollars to be used for the folks that need it or use more services? Is that a better way of looking at it?
Yeah, I'm not sure it's still entirely true, but I think it's a balancing effect. I
Thank
guess
you.
is
That's
the
all I
way
have,
I
Madam
would
Chair.
describe it.
Thanks, Representative Connor. Representative Blyer.
Thank you, Madam Chair. Thank you, Ms. Trundy. And I was, John kind of answered that last question. Having these members in the pool at a young age is beneficial to the program, and by allowing them to go into another type of insurance product outside of the state-run program would be not detrimental, but would hurt the program. So having them in this program, passing this bill would hurt the program in a sense, potentially.
I would say yes, potentially. We've kind of struggled to get our hands around some firm numbers with this bill. We don't know how many state employees or how many retirees we have who are active duty guard or former active duty guards. So that's just not information that we have collected on state employees. So we're struggling to come up with what the financial assessment of this bill is. What I do know is that we've got about 12,000 state employees. 9,000 of those approximately are participating in the state employee health plan, and approximately 3,000 are opted out. And so not all of those are going to be folks who have access to TRICARE, but a lot of them may be folks who are accessing health insurance through their spouse. But that may also be the next thing that if this bill passes, the next thing is folks who previously opted out because they were accessing health insurance through their spouse.
Ms. Trundy, I'll just note that you guys didn't submit written testimony or verbal testimony, I don't think, at the public hearing. Had you done so, would you have been neither for nor against, or would you have been in opposition?
Ooh. I think probably we would have come in as neither for nor against, but these would have been the things that we would have highlighted. I think it's still a week after the public hearing. We're struggling to wrap our arms around the financial question and how we're gonna do a fiscal note on this. I don't know yet.
Okay, Representative Tepler.
Thank you, Madam Chair. I am wondering if Anya could talk about this. We're talking about retirees now, correct? Not just state employees opting into the state employee program, but people retiring and having, after they retire from the military, then opting into Maine state retirement in health insurance.
I think the group that we're primarily looking at are for whom this bill was primarily brought are folks who would qualify for one of the special retirement plans, and so they'd be qualified for early retirement based upon years of service, and that the alignment of the time at which they go off TRICARE may actually align with when they are retiring. Because I think it's less likely that you're going to have a lot of folks who are going off of TRICARE at age 65 going into a Medicare pool. And the Medicare pool is different, whether they get Medicare Advantage through the state or whether through other employment they have access to the original Medicare as paid in through Social Security.
So they're taking early retirement from the state. They've retired from the military as well. And the question then is, what percentage of their healthcare bill is the state covering through the retirement plan? What percentage of their costs?
Well, if they have no participation in the state employee health plan, then they have to meet that eligibility requirement at the tail end of their employment. But you could meet that, but then not have the years of participation in the state employee health plan such that the state is going to pay a large portion of your insurance premiums.
And under this bill, then the state would pick that up as though it didn't matter what they had paid in. Now I'm getting even more confused, I'm afraid.
I don't think that is the case. I think the bill is about enrollment.
Okay, so it's just an opportunity to enroll, but the state provides the same percentage regardless of when they are given the opportunity to enroll, if they are given the opportunity to enroll.
The percentage will be based upon whatever their years of participation are. So if they are a more current hire, they would have to have 20 years of participation in the state employee health plan in order for the state to pay 100% of their premiums.
Okay.
So there is a financial interest for the employee in terms of the percentage that they have to pay in their retirement years towards their premiums to be a participant of the state employee health plan throughout their years of retirement. And perhaps Colleen could offer some clarification about whether the bill would actually, whether I guess it would kind of credit them for those years that they were on TRICARE.
That's the question. Okay, yes, thank you.
It looks like it doesn't. Colleen, do you agree?
It does not, no. It doesn't credit them for the time that they're on military service.
Yeah.
But what it essentially does is it removes that requirement that they have to have participated in the group health plan at least 1 year immediately prior to their retirement. It does limit them to electing the re-enrollment once. So they can't be moving back and forth. It has to be either at the time they lose their military coverage eligibility or at the time of retirement, as it's drafted. And that's consistent with some of the other exceptions that have been provided in statute for allowing re-enrollment. And I think part of that is to get at some of the financial concerns that Ms. Trundy mentioned about people moving back and forth and making sure that the pool, the experience of the pool is balanced. I'm checking your issue about whether or not it removes what effect it might have on the share that the state would be responsible for paying for someone who does re-enroll. I don't think it changes that, but I just want to confirm that.
And the share is based on years of enrollment in the health insurance program, not years of service.
That's right. That's correct.
How odd. Okay.
That again, I think was put into place, as I understand it, particularly because of the nature of the self-insurance, arrangement that we have, and to try to manage those risks as opposed to just years of service. They want folks to have been in the plan. So.
Yeah, but to clarify for you, Denise, I think to answer the confusion that you have, it's not like you're paying in and then your dollars are somehow sort of in trust for the future. It's just that if we have young people not in the plan in any given year, then the risk pool is out of whack.
Affects the risk pool. Yeah.
Yeah, Representative Tepler, does that answer that question, or did you have another one?
I am still, what I'm waiting to hear from Colleen, I guess, as she reviews this, is if you're enrolling as a retiree for the first time in the health insurance plan, or if you're re-enrolling, say, following 20 years of military service to the National Guard, it sounds like the state share of your premium is going to be pretty low. You're going to be paying a fairly high percentage of your premium because you won't have been in the plan that long.
Mm-hmm.
So you have the option of the group health insurance or the employee plan, but you're still going to be paying a greater share than somebody who's been in all the time.
Yes, that's right.
Okay.
So yeah,
I mean, trying to clarify.
There are two different thresholds now in statute for people who were first employed after 1991 and persons that were first employed after January of 2011. In order to have 100% of your premium paid in retirement, you have to have had 10 years or more participation in the group health plan. For those who are first employed after July 1 of 1991, and then it goes down, 9 years is 90%, 8 years is 80%, and then it goes, the portion goes down. And then for those who are more recent hires after July 1 of 2011, the state will pay the retiree share of the premium, and that just goes to the retiree share, not to any spouse or dependents that they might be able to enroll. You have to have 20 years of participation in order to get 100% of the premium. And for those employees that have less than 10 years of participation, the state doesn't contribute anything. So that was a change, a big change in 2011 about the state's portion in retirement. So for those who have 15 years, between 15 and 20 years, the state pays 75%. Between 10 and 15 years, the state will pay 50%. But again, if the employee has less than 10 years, there's no contribution by the state. It's fully paid by the employee or the retiree in this case.
Representative Connor.
Thank you, Madam Chair. So just for my own clarification, it's 10 years of participation and enrollment in the state program that they would get the 100%. So in the instance of, I'm sorry, go ahead.
Now. It's 20 now.
20. So they would be, if they are not enrolled in the program, this bill will not alleviate that. I read this bill as it was alleviating that if they were so choosing to go into the TRICARE bill or TRICARE system, then that is acting as if they were on the state program. And when they come to retire, they can still get the 100% as if they were enrolled for 20 years. Is that not what this bill does?
I don't know if that was the intent, but I didn't take it to be written that way.
Yeah, I don't think the bill is written that way. That may be the intent of the proponents, but the bill as drafted would not count those years of TRICARE experience as if they were years in the state employee plan. I think if that's the case, then the bill would need to be amended to do that.
So when this member that for instance, the game wardens that brought this bill or were proponents of it, when it comes time for them to retire, they're going to be paying a larger premium. Is that how it's read? Because they were not technically enrolled for the 20 years?
Representative Connor, oh, sorry, Colleen. I was just going to say yes. And what the bill would do is allow them to access the program at all. because under current law, they wouldn't be allowed to enroll, period,
Right.
in the program. So that's the problem it's fixing. I don't know if that's the whole problem. It probably isn't, but that's all this bill as drafted would do.
Okay.
The other thing I would point, the other thing I would point out is the way that the language is currently drafted, it doesn't specify that the years of participation have to be continuous or, prior to retirement. It just says, 20 years of participation or 10 to 15 years. So I think if they had some prior years of participation before they re-enroll, that I think is the way the language is drafted might qualify them for whatever category they might, be eligible for in terms of the state's share of the premium.
Thank you. Thank you for clarifying that, Colleen. I appreciate that.
Ms. Trunde, the conversation we've just had on mic, does it help you understand the fiscal note better?
I mean, I think a little bit. I think actually that last exchange right there where we were talking about, I imagined a situation in which a retiree was not bumping right up against their retirement date, and where they may have come in, they may have come back into the program and, have let's say that they have 10 years at that point in time. And so it's the difference between not being in the plan and qualifying for a partial payment by the state. I think we're still going to struggle with the fiscal note because the underlying issue is that we don't know how many of these employees we have.
Right. And just to clarify further, I think if someone is waiting until they're 65 to retire, then we're in a whole different pool.
Yeah.
Okay. It's complicated. All right. I still don't have a motion. We've had a good conversation. Representative Tepler? Representative, you muted yourself as I called on you. Go
I
ahead.
didn't realize I was unmuted, sorry. Yes, I am interested in making a motion to pass. I don't know if it's as amended, Colleen, yes, with the fiscal note, if nothing else.
Yeah.
Because I think the opportunity to enroll in the group health plan is a reasonable one for someone who is retired military but working for the state. So,
is there a second?
I'll second.
Okay. So it's been moved and seconded to pass this amended. Is there further conversation? Representative Evans, you're on mute.
Just a clarification, it might, to speak to Representative Connor, it might be better if the ranger would go ahead and enroll in TRICARE, because those benefits are not going to drop. But once that person is retired, you don't have to worry about have you been in 10 years or 5 years or whatever it is. So you would be still guaranteed to have that coverage, and the coverage is not going to change throughout your lifetime through TRICARE. So it's 6 on one hand and half a dozen on the other. That's all, I'm sorry.
Thanks, Representative Evans. I think we're looking at folks who might not be eligible for military coverage during their retirement years, because for TRICARE for Life, you have to have a certain number of years of service.
Right.
Okay.
Understood.
Are we ready for the vote? All right. Looks like it. Go ahead, Christian.
Representative Quint.
Yes.
Representative Quint, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Millerano.
Yes.
Representative Millerano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator
And
Sanborn.
thank you,
Yes.
Ms. Trundy, for all of your help. And I'm sorry about the fiscal note, and do the best you can.
It
All
might be one
right.
of those. Can't determine. Who knows?
Yeah. All right. So with that, we can move Ms. Trundy back through the wormhole from whence she came, and we will pick up LD 1085. And I'm going to have Colleen do her presentation.
Christian, the answer to your question is yes. So, all right. Oh, I apologize. I don't think I have 1085 up. So give me a second. I forgot to get it up.
No problem.
1 sec. Have it here.
Oh, why is okay? We're gonna have Colleen do her bill analysis before we bring anybody in. Representative Hymanson.
Okay. I don't know what happened to it. Now I don't know what happened to it.
Didn't you just have it up?
I thought I did, but it wasn't there. So I'm gonna open it again. Oh, here we go. Okay, I'm gonna share it again. I have it up, but for some reason, it shows at the top that it's a different LD number, but you're seeing 1085, right?
We are.
Okay,
Go
great.
ahead.
So this is a bill that seeks to make changes to the current law's requirements for the use of genetic information for insurance purposes. The bill would repeal the current law that currently prohibits discrimination by insurers on the basis of genetic information or testing, and would enact a provision prohibiting, after January 1 of 2022, insurers that issue individual or group health insurance or dental insurance, life, credit life, disability, long-term care, and other types of limited benefit insurance from canceling, limiting, or denying coverage or establishing differentials in premium rates based on genetic information under certain conditions, and would further prohibit those insurers from requesting, requiring, purchasing, or otherwise soliciting genetic information, using genetic test results, or considering a person's decisions or actions relating to genetic testing in any manner for any insurance purpose. As I mentioned, there are some provisions in current law that do protect individuals from the term used in the statute is unfair discrimination relating to the use of genetic information in insurance underwriting. Unfair discrimination is described as including but not limited to the application of the results of a genetic test in a manner that is not reasonably related to anticipated claims experience. There are also several other instances in the statute where individuals are protected from unfair discrimination in this manner. There's a current law provision that relates to individuals who have HIV or AIDS. There's a provision related to individuals who are blind or have a physical or mental handicap as defined in Title V, which is the Human Rights Act. There's a provision relating to victims of domestic abuse. There's a provision relating to those who donate organs, live organs. And then there's also a provision that was enacted in the 129th legislature relating to consideration of the purchase of naloxone by an individual in life insurance underwriting. For health insurance plans, those are currently not subject to underwriting, and carriers may not request, require, or use genetic information for any insurance purposes under both current Maine and federal law. The sponsor and proponents of the bill, and I did want to note that I think Representative Hymanson has shared some additional testimony yesterday and has shared it, since the public hearing. So that's all been uploaded to the electronic LD file. But the concerns that they have raised relate to the use of genetic information and genetic testing by insurers that those concerns may discourage individuals from seeking genetic testing, and that genetic testing at one point in time does not reliably predict most health outcomes. They also raised concerns that the use of genetic testing and information by insurers could have a disproportionate effect on people of color and increase racial disparities. I did want to note, as I mentioned, there is a federal law that protects individuals from discrimination on the basis of genetic information or testing by health insurers and employers, but its provisions do not apply to life insurance and long-term care insurance. And I think that's part of what our current law focuses on with regard to the unfair discrimination, requiring that the information has to be reasonably related to claims experience. And what LD 1085 would do is prohibit the use of that information altogether for life insurance and long-term care insurance purposes. The Bureau of Insurance in their testimony noted that insurance markets overall must be stable and that coverage in all lines be as available as possible and consistent with responsible underwriting practices. Underwriting for these types of insurances, and I'm not talking about health insurance, but for the other types of insurance like life insurance and long-term care insurance, underwriting is an essential part of evaluating the risk, and it's appropriate for insurers to have the same information as applicants have. While the Bureau suggested that insurers should not be allowed to have access or to require consumers to obtain genetic tests, a lack of balance in the information between an insurer and an insured could lead to instability in the market and lead to adverse selection concerns overall. You had a number of concerns that were noted by the insurance company representatives that testified on LD 1085 related to those adverse selection concerns that I just noted, and their inability to make accurate risk assessments in underwriting if the bill moved forward as drafted. They noted that insurers should have access to complete and accurate information, including genetic test results if they exist, in the same manner as they have with other medical test results, and denying access to this information might also mean that some applicants with serious conditions that are not genetically linked could be denied insurance or charged higher rates, while applicants with known serious genetic diseases could avoid disclosure and obtain life insurance at lower rates. Also, they noted that these restrictions as proposed in LD 1085 might result in the unnecessary denial of insurance to people who are potentially insurable, but based on their family medical history, but genetic test results might ameliorate some of those concerns. The sponsor, Representative Hymanson, did suggest an amendment to the bill that was shared with the committee. Again, that would remove the provisions applicable to health insurers, recognizing that the use of genetic information is already prohibited, or the underwriting in health insurance is prohibited, but would retain the prohibitions in the language of the bill for insurers that issue the other types of insurances that are medically underwritten. I'll stop there. We don't yet have any fiscal information on LD 1085. I guess I would just note too, which also was raised at the public hearing, we did have consideration of legislation last session that was brought forward by Representative White, and the committee replaced that legislation, which is similar to what Representative Hymanson proposes. The committee replaced the prohibitions in that bill with language related to the use of sort of retail genetic tests, and put a provision in the statute related to that. And I did want to note that Representative Hymanson's proposal does not retain repeals that provision in the current law. So if you do move forward with some version of Representative Hymanson's bill, you may want to just retain that provision in current law that you put in place last time, related to sort of the 23andMe type tests that folks have access to now on the market. I'll stop there.
Yeah, and I'll just point out, as Colleen said, we added that protection last year from 23andMe. I always say last year, it might have been 2 years ago.
Yeah.
Or 3 years ago, I don't know. but it also prohibits the insurance companies from buying the information directly from 23andMe. So there's some important privacy protections that I think would be missing if we repealed that section as well.
Right.
So the sponsor is with us, and I will bring her over now. Is Representative Hymanson on her way, Christian? Yeah, okay, there she is. All right, her wormhole journey was particularly slow today. All right, go ahead and unmute yourself if you would, Representative Hymanson.
Said my wormhole journey was fun.
Oh, good. So you had raised your hand at the beginning. Oh, can you hear me?
Yes.
You had raised your hand at the beginning of Colleen's presentation, so I wanted to acknowledge you and give you an opportunity to speak to the committee.
Oh, thank you. I do have that very brief amendment, recognizing that it took 10 years for the federal government to design GINA to take away the healthcare genetic testing in healthcare. So I thought it was redundant, and my intent was not to remove the the 23andMe statute, which is very good and well done. And so it really leaves where we are now, and I'm hopeful that the committee was able to read about the extensive Maine experience of 3 physicians, a genetic counselor from the Mass General who works through York Hospital and Central Maine Medical Center. That's Miss Shannon, Dr. Meisfeld from Maine Medical Center in the cancer department, an oncologist who has a lot to say about this, and how, and what I was asking them to respond to was, are people harmed by this? And their answer was a resounding yes, that people do forego important genetic testing because of the fears of insurance being underwritten, not in their favor. And so this bill is really speaks to patients and people who have medical problems that need to be addressed genetically, and how they're being hindered by the insurance companies accepting this information. So there is harm on both sides. And we heard loud and clear from the insurance company how they feel they would be harmed. Florida decided that that wasn't good enough, and they didn't need any more tools in their toolbox, and they passed this law. This bill is on the side of the patients, that people need to have access and can't be fearful of a genetic test that they need to have because of the insurance company underwriters gathering that information. And that's the intent of this bill.
Okay,
So
thank you, Representative Hymanson. Are there questions for the sponsor? All right, seeing none, I think we're gonna, oh, Representative Tepler's got her hand up, go ahead.
Thank you. I'm sorry. It took me a minute to find my hand. As it were. And thank you for being here, Representative Hymanson. I'm wondering, so this issue of people being afraid to get genetic tests, to me, it seems like it's possible when you know you might need a genetic test for you to go out and apply for that insurance immediately, and then afterwards get the genetic test. And I guess I'm confused a little bit about the fear that people have of the power of the industry, particularly around life insurance and long-term care insurance. I mean, long-term care insurance, if you don't buy it when you're young, it's pretty prohibitively expensive. And the chances that you'll get it when you'll get it after a genetic test when you're young seem odd to me. And life insurance is kind of similar. Can you speak to that a little bit?
I can attempt to. There is someone in the waiting room, Dr. Farrow, who is a MD PhD with his PhD in genetics, and he is from Fairfield, Maine. That's where he practices. And he may be able to flesh this out a little bit better. But I don't think it should be in the patient's hands to scam the system, meaning they apply for insurance and then they get the test, and they have to know in order to do that, they have to know that. So, you know, I was in private practice and saw patients for 25 years. During a lot of that time, pre-existing illnesses were on the plate. And I would, when people would say to me, they have low back pain, I would say, okay, you can tell me that. I'm not going to put that in your chart, because if your insurance company gets a hold of that, that's a pre-existing illness and you'll never get coverage for that again. So I don't like to be in a position where a physician would say to a patient, get your life insurance now and then we'll do the test. I just don't think, I think that's asymmetric, and I don't like the ethics of that.
So Representative Hymanson, I have a follow-up question for you then, because what happens under the Florida law is that you say to the patient, get your test. Oh, your test says you have Huntington's. Don't worry, go ahead and buy $12 million worth of life insurance, and your family will be covered, and you won't have to disclose that genetic test to the life insurer. So the asymmetrical information is much, 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 much worse under the Florida bill. You know, the scenario you just explained of scamming the system, everybody's taking the risk, right? The patient doesn't know whether the outcome of the genetic test might be positive or negative. They haven't taken the test yet. And the insurer doesn't know if the outcome of the test is positive or negative, and maybe doesn't know the patient is going to take it, but also just nobody knows what the answer is until after the policy is written and priced. And so that's our current law, is everybody's got the same information once the information is known to science. And to me, that's information symmetry. It's not scamming. Whereas if you take the test, but don't have to disclose it to the life insurer, then that's total information asymmetry, because it might really influence how much life insurance the patient wants to pay for, right? If I knew I was going to die before my son graduated from college, I would pay almost any amount of premium to beef up the amount that he was going to get when I passed. Because I wouldn't be paying that premium very long, and I'd know that because I had information asymmetry. But that's
So
the
let
problem
me
I'm
take
seeing.
Huntington's disease. I'll take that exact diagnosis. So that's a 50% of people who get the will inherit the gene. It comes down through family history. So in every person, except for very rare cases, and I'll go into that, there's a family history, because it penetrates the family history. And so on the medical chart, there will be family history of Huntington's disease. And so the life insurance company, the underwriters, know that because they have that family history. So all of that can be in the chart.
Yep.
The only time when it doesn't happen is someone who's maybe adopted and doesn't have a family history known, but they wouldn't know they were looking for Huntington's disease. So generally they present with symptoms. So they would come in with symptoms, and then that would be on the chart. So it would be very unusual. I can barely think of a time where there wouldn't be something in the medical record that didn't indicate that there was a family history, which is all admissible, or there wasn't a symptom that might indicate that that was there.
But under the Florida law, isn't it not allowed for the life insurer? Let's say that the daughter of someone with Huntington's disease gets tested and finds out she's not positive, she did not inherit the disease, under the Florida law, the life insurer is not allowed to look at that genetic test, and therefore not allowed to disregard or unprice or undeny her coverage. And so her daughter, her son, who's a teenager, isn't able to have life insurance, even though the genetic test would have sort of exonerated that medical history. Isn't that the case under the Florida law?
I have to imagine that there would be a question that someone could ask the patient to reveal. And it's not that the insurance company is getting that test, but the test result, but the patient themselves may be able to say, I'd self-disclose with some consent form or some self-disclosure.
Isn't it a problem if of information asymmetry and scamming the system, if in fact the genetic information only has to be disclosed when you want or when it's favorable to you? It seems unusual for me that that's how we would put the information asymmetry. It's not a bright line at that point, right? On genetic information, genetic testing, either it shouldn't be used at all, or it should be used, but allowing the patient to disclose it selectively seems like the worst of all worlds.
Well, either, there's problems with the insurance company, and there's harm with the insurance company, harm with the patient. What I'm saying is that we should shift the harm reduction on the patient side and protect the patient or the person, I wouldn't even call them patients, persons who have a genetic vulnerability, who need to have that information, and they're not getting it. And the people who wrote testimony have told us that they are not getting that genetic information that would help them with their lives because they have fear of the insurance market. That's the testimony.
Yeah, Representative Tepler.
Thank you. Well, Dr. Firo, who's in the attendee list, it has his hand raised. I wouldn't mind bringing him in.
Okay.
Something to say. So it would be, I think, worth hearing from him.
Hello, committee members. Can you hear me?
We sure can, and you can activate your video if you are able.
Affirmative. Excellent. So I will put on my video here as well. Thank you for allowing me to speak today. I just wanted to make a couple of quick points. First, in your summary document, GINA was actually enacted in 2007 and put into law or put into action in 2008, just for your reference. I would say, listening to your conversation and thinking about this bill, the insurance industry is very interested in you thinking about conditions like Huntington's disease, which are very highly penetrant, meaning that if you inherit the variant associated with Huntington, you have a very high probability, essentially 100%, of developing disease. But I would make the point that most genetic tests are in fact far less predictive in their outcomes than Huntington's disease, and in fact may have much more modifiable disease trajectories. So, for example, I think Sue Meisfeld raised in her testimony the example of hereditary breast and ovarian cancer syndromes. Several decades ago, we didn't know what to do with those patients. They had a very high risk of developing breast cancer, but now with chemoprophylaxis or surgical prophylaxis, they're able to modify their disease trajectories. And it is to their advantage to know at a younger stage of life, when they may be not thinking about these types of insurance products, to be purchasing, not be purchasing necessarily those insurance products, because they're going to be spending, resources over many years that they may not need things like long-term care insurance. And so there's two elements there. One is the most genetic tests are not as predictive in terms of their outcome as Huntington's disease testing is. And the other part of that is that for many conditions, the disease trajectory itself is modifiable. And so that denial of insurance based on a genetic test obtained at one point in time without taking into account of modifications is definitely not to the patient's benefit. And my guess would be that as we have more sort of what we call polygene panels that predict common things like cardiovascular disease risk or stroke risk, for example, or type 2 diabetes risk, that patients will benefit knowing that information early on and then acting on it to actually modify their risk over time. If insurers have access to that information early on as a one-time snapshot, I suspect they will err on higher rates or denial for those patients. And I think that's definitely not in either the patient's advantage, to the patient's best advantage, or frankly, society's best advantage to have those types of products be less accessible. And in my written testimony that I submitted, I think there's one other point to make, which is right now, much of what we know about genetic risk prediction comes from largely white Northern European populations. And the risk models do not work particularly well in individuals from diverse ancestries. But I think it will be very tempting for insurers to try to use those risk models to set rates and determine eligibility derived from one population in another population. And that could have a sort of a very differential impact on some of the individuals who are most vulnerable in our society, which can have generational effects on household wealth and incomes. With that, I'll stop. Thanks.
Are there additional questions for Dr. Farrow or Firo? Representative Tepler.
So I'm sorry.
You're on mute.
I had to
Thank you, Madam Chair. One of the concerns that this committee has, I think, or some members of this committee have, is that asymmetric information, which we've talked about a lot, will drive up the cost of long-term care insurance and life insurance for everyone, not just those with risk profiles that are concerning. And so I mean, what I would really love is to be able to wait and see how the Florida law works out. Part of me is a little worried that if we're the second state to enact this and it's not working well, we might have a problem, particularly in a state where a lot of people have difficulty affording life insurance and long-term care insurance. So I guess that's just something I want to put out there, that I would love to maybe wait and get a report from our Bureau of Insurance about the Florida law. Just putting that out there.
Representative Arford.
Yeah, just first of all, thank you, Madam Chair, for recognizing me. Thank you, Representative Hymanson, for being with us today and for bringing this bill forward. I will be supporting this bill for two primary reasons. First of all, I support a policy of personal information privacy. And to me, to a certain extent, this boils down to the policy of this is information an individual decides they would like to know about themselves to use for specific purposes. And they should not have to consider the burden of other entities having access to that information in ways that may not be beneficial to them in making that decision. I myself had my second child at age, I had my first child at age 39, and it was highly I did go through genetic testing, and this wasn't an issue back then. And if I had to consider what the outcome might be for my children, if there was information that was negative that might somehow travel through their health records, or they might be asked down the road 20 years from now, as this industry evolves for this information, I didn't have to consider anything like that. It was not an issue. So that's number one. And number two, I think there's any number of scenarios where this information might be used in a manner which would increase the cost of long-term life insurance for people or decrease it. So for instance, if you do take the test and it turns out that you have no life-threatening factors, then you might choose never to get life insurance. So I don't want to even speculate as to that. I want to think about the policy and what's best for the people of Maine. So I thank you for bringing this bill forward.
Are there additional questions or comments? Representative Brooks. You're on mute.
Yes, I was saying that I have gone back and forth on this bill, and the idea of penetrance is a powerful one. Like that, if somebody is being proactive in getting this genetic information, they could be, that could benefit their health care. But I could see it as a deterrent, just similar to when we didn't cover pre-existing conditions. And I think that penetrance is a big example where we could alter the course of the disease by knowing early. So I'm leaning towards supporting it, or at least keeping it alive to get more information from the Bureau of Insurance.
Additional comments? All right. Oh, Representative Quint, go ahead. There you go.
There we go. Thank you so much. I'm actually torn with this bill because I'm a major privacy girl. When it comes to information, I think when we first started at the beginning of the year, you saw that just with the reinsurance and other countries. So I totally get this. However, I do see the opportunity for fraud if someone were to get this information, not have it disclosed, and then go and get life insurance, knowing full well that they have something and that the life insurance company doesn't have to find out about it. So there's a big disconnect for me, but this specifically is for life insurance alone, and nothing else. So I'm actually against this bill for that reason. Thank you.
Are there additional comments? Senator Brenner.
Thank you, Madam Chair. I feel pretty torn about this as well. And I think the issue is that as a business, life insurance is a gamble, right? I mean, it's this product that's set up to balance risk with life. And so, we're creating a pretty unfair playing field, but at the same time, I also really respect patients' capacity to want to have more information about their healthcare. So you've really brought us a interesting bill, and I don't think I feel decided. I don't want to gut the life insurance industry with legislation that changes the playing field, but at the same time, I don't want to limit patients' interest in knowing more about their genetics.
Thanks, Senator Brenner. I want to refocus. I think this is somewhat responsive to the idea of penetrance or susceptibility versus certainty in the Huntington versus other things, but we do have an unfair discrimination statute in Maine. I'm not sure it's been used very much, and perhaps that's because the life insurers are doing such a great job of being fair and reasonable, or perhaps it's because we haven't sort of gone into the great world of genetic testing as far as we could go yet. But you know, if I knew that my mom had died of breast cancer and then I got the test and I was BRCA positive and then I got a prophylactic double mastectomy and then a life insurer discriminated against me on the basis that I was BRCA positive and denied me coverage, I would have a claim against them. And I could bring that to the superintendent, and that's an unfair and deceptive practice in Maine law as it is, because it's using a genetic test in a manner that's not reasonably related to anticipated claims experience, if I understand the science right about the efficacy of prophylactic mastectomy in that situation. So I think that, you know, that's obviously another extreme example of prophylaxis, right? It's not just a change in lifestyle, it's an actual surgery or whatever. But I think we've got a provision in Maine law that acknowledges that genetic tests might be misused or might be used in ways that just kind of err on the side of caution. And if a life insurer does err on the side of caution in a way that's not reasonably related to anticipated claims experience and they can't back it up, then they're violating the statute as it stands. And so I feel like that's the way that we balance the scales here, is by saying you can't use it wrong. You can't use it against patients in a way that doesn't actually reflect their health risk or reflect their true health status. But true health status is the thing you should be underwriting on, and we're not gonna fake that. Representative Tepler, go ahead.
Thank you, Madam Chair. I realize that you have made up your mind about this bill, but I am torn, and I've heard several members of the committee express their uncertainty as well. And I'm wondering about whether or not we should move to table this and work it again another day, do a little more thinking about it. I would be willing to make a tabling motion, recognizing that that's not debatable. So I'll hold off until any further commentary has been made.
Representative Morris. Thank you, Representative Tepler. I think that's fair. Representative Morris.
Thank you, Madam Chair. I'm certainly okay to table and work another day, but I am in line with you on this issue. As you know, I think that I think we have to be careful with how we handle this particular issue as it relates to life insurance. We want to make sure that it stays affordable for everybody as well. And I think I just worry if we start getting too much into the weeds on some of these policy things, it's going to make life insurance more unaffordable. So again, I probably won't support the bill even if we work it further, but I certainly, if other members of the committee want to, that's fine.
Okay. I don't see any further comments. Representative Tepler, if you want to make a motion.
I move we table this to work again another day.
Okay, is there a second?
Second.
Representative Arford seconds, and as a tabling motion, we can do it with your physical hand in the window. If you would hold it up until Christian's counted them all. Representative Evans, are you voting in favor of the tabling motion?
No.
No, okay. So it's 11 in favor and 1 opposed. Okay. Great. All right, so the bill has been tabled, and we thank you for joining us, Representative Hymanson and Dr. Farrow.
Thank you for your thoughtful discussion. I really appreciate it.
Thanks. That was good discussion, I think. Very substantive. Not all of our work sessions get that way, so this is good. Okay, our next bill that we're going to pick up is LD 1150. This is Representative Brooks's bill. We've already had a work session on this bill, so I'm not going to ask Colleen to do her presentation again, because we've already seen it, and we had talked about and then tabled the bill, and we had talked about amending it to strike out the whole thing and just include a provision that would set the smoking variability to 0 beginning for plans on or after January 1st, 2023. So that with that, because that was sort of what we previewed for everyone that we would make a motion today for, I would make that as our motion. Ought to pass as amended, just with the smoking piece.
So can I
Point of order, Madam Chair.
Yeah.
Yep, just to go ahead,
Representative Connor.
Representative Connor, go ahead, and then we'll get Colleen.
Ma'am, do we need to make a motion to take it off the table first?
Oh, sure, we could do that. We noticed the work session for it, so I don't know if we actually have to do that because we noticed it as a work session. I think
so.
I don't know, but I'm happy to do it if you want to do it.
I apologize. I don't know if I was there when it, and I don't know if it was tabled or not, but it sounded like it was tabled, so I wanted to be proper.
Sure. Yeah.
But-
Okay. I don't know. We've never done that when we renotice a work session. I've certainly done it when we're in the same day, but we can do that if we need to. Colleen, do you think we need to do that? Another motion?
I don't think so. I mean,
okay.
We haven't done that in the past if we renotice
Yeah.
it, but in the same day you usually do,
Notice it.
but not.
In the same day, we would need a motion, but I think if you renotice it, it's like something going onto the calendar or something like that. It's a little different. Yeah. Thank you though, Representative Connor. Yeah. So Colleen, what was your question?
My question was, my understanding of the discussion of the amendment last time, and I did prepare language for it, was that you would phase out the 1.5 factor. So it would be reduced to 1.2 in 2023 and then eliminated in 2024. But
great, let's do that. That's what I meant.
Okay. So I just wanted to, that's what I thought you discussed last time. So I do have that language if that's something you want to see, but.
Yeah, does anybody want to see the language before we vote? I think we trust you, Colleen, to have written that down, and I just forgot that nuance. Okay. But yes, it was a phase out over 2 years, starting in 2 years.
Yep, 0 in 2 years. Yep.
Yeah. Okay. Is there further discussion on the bill? Representative Morris.
Thank you, Madam Chair. As you know, I oppose this. I believe that, smoking is a choice. We all know that, the consequences of it for their health. And I think people who choose to smoke, I don't think that we should be subsidizing their rates by bringing it down to 1-to-1. I believe that, there is no, this policy, this is just really not good policy to be bringing it down to 1-to-1, where there are increased health risks for people that smoke. And I think that it is not unfair or discriminatory to expect someone to deal with the consequences of their decisions. So I will be opposing this motion.
Representative Brooks.
Yes, I think this is a really important issue, and I do appreciate the testimony of the American Cancer Association, Cancer Action Network, and the American Heart Association. I think that smoking becomes an addiction. It becomes a something where the tobacco industry has added nicotine to products. The first filters, I don't know how widely this is known, but the first filters were made out of asbestos. So they could start at a very young age. So I could definitely see the addiction part of smoking and how hard it is to quit. Many people try on different occasions to quit, and one of the things that makes them more likely to quit is to have a provider that recommends that, and that's been shown to work in some cases. There are other medical services that a provider could offer to help a person quit smoking. And when we're increasing the rates or pricing smokers out of the system, it's really dangerous. And we're taking people out of our healthcare system, taking away their access to all, or making their access to healthcare a lot harder, putting up barriers. And it's a very slippery slope as well. I mean, we could easily say somebody that's over 150 pounds or whatever their body mass index is, they would also have a higher projected medical expense potentially. And by picking out one thing, and this also isn't, yeah, I just feel strongly that this is something that we're really on a slippery slope where we've gone and said, yeah, that this is something that we won't have in the would make insurance less attainable for them. And also keep in mind that with rating factors, this rating factor, it could be quite a dramatic increase in their premiums and in their lack of access to the healthcare services in all areas.
Representative Tepler.
Muting myself. There we go. I keep muting myself when I mean to unmute. I'm sorry. I will be voting with Representative Brooks on this. I consider tobacco addiction to be similar to a pre-existing condition. If it doesn't get treatment, it becomes more of a problem for health. And if we make insurance for people who have risks like pre-existing conditions more expensive, then we end up paying more for their health care in the long run than we would if we made the insurance accessible to them from the beginning. And there are treatments for tobacco addiction like Chantix and other and patches and things that do help people to quit. And making insurance available to them is an important part of that process. And if we wait too long, they'll get cancer and cost us a ton of money. So why not spend a little more now to get them insured and make sure that they're getting the treatment they need to get off tobacco? And I will say that as a former smoker in my 20s, this is something I really understand. And I was fortunate to have a working smoking cessation group that I attended that was sponsored by the American Cancer Society.
Representative Quinn.
Okay.
Yes.
Yes, okay, thank you. I am also opposed to this bill. I find that we are continually moving personal responsibility out of this. And yes, Representative Brooks, I mean, we can go into other areas of life, but also in those areas of life, personal responsibility, once again, does play into this. And our healthcare price is becoming unsustainable because we are removing that from people. It's not as though people who smoke do not understand the consequences. We have been, educated about this for years and years and years. And so I totally see where you're coming from as far as doing preemptive care with them. But once again, this care is whether they're on insurance or not, and quitting smoking is just that. It is quitting smoking. So that is why I am opposed to this. Thank you.
Representative Arford.
Thank you, Madam Chair. Thank you, Madam Chair, for calling on me. And I just would like to say I will be supporting this bill, and I for the same reasons as the people who are supporting them on our committee have expressed, so I won't repeat that. The one thing I will say is that the research has demonstrated, the recent research, that it does not act as a deterrent to increase the price of their insurance for people who are smokers. And we also know that there has been a resurgence of smoking amongst younger people, particularly in Maine, due to the flavored tobacco products. So are we going to start charging 18, 19, 20, 21-year-olds higher fees because they are now early smokers, and basically in many instances, assisting in the denial of the care they need so they can stop at an early age. I just would really ask people to think through this, not from a punitive perspective, but from looking at this as an addiction. These are people who have an illness and they need help. And if we do not pass this bill, we're actually acting to put financial barriers in the way of them receiving the help that they desperately need. So that's where I sit.
Okay, anyone else want to comment? All right, so there is a motion ought to pass as amended. It has been seconded. It has not been seconded. It's seconded by Representative Tepler, and the clerk will call the roll.
Representative Quint.
No.
Representative Quint, no. Representative Connor.
No.
Representative Connor, no. Representative Blyer.
No.
Representative Blyer, no. Representative Morris.
No.
Representative Morris, no. Representative Matheson. She's not on the call. Representative Matheson is absent. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Millerano.
Yes.
Representative Millerano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That is 7 yes, 4 no, 2 absent.
Representative Matheson is having difficulty with her internet. So she's written to us a couple of times that she's had to go in and out.
So hopefully she'll be able to join us as we continue through the work sessions today.
Can I just confirm the minority would be on ought to pass, right? From all.
Yes.
Okay. Thank you.
All right, so the next bill is LD 1331. And it is an act to reduce geographic rate variability. I don't know if we need to have a presentation on this one, Colleen. I guess I would just ask if we have yet received any information about what the rate variability would be if we were to enact the bill.
Yes, we did. I did forward some information from Marty Hooper yesterday from the committee, and she's here and she can speak to it.
So why don't we have
But
her
I
do a
included,
presentation of it, because I haven't seen that information. So maybe you can share it and she can walk us through it
Sure.
if she's here. I don't
Pull
see
it up
her.
and pull her over.
Oh, she is here. Yeah, great.
Yeah, I'm gonna try to see. I had some problems saving it as PDFs, but I'll look at what I can share. I put some stuff in my bill analysis too, so I could share that at least to summarize her bottom line. So let's see.
Yeah,
But I'll
that
let
would be
Marty
great.
speak first. Yeah.
Hi, good afternoon, Ms. Hooper. So I haven't seen the data yet. Can you give us the highlights, and maybe Colleen can share the top line data with us?
Yes, good afternoon. I'm Marty Hooper, the Life and Health Actuary at the Bureau of Insurance. My camera's acting a little strangely, so
you're fine.
I'm trying to get
You're
in
fine.
there. I don't have it right in front of me. Colleen, were you going to pull it up or?
Sure, I can share. I pulled out, sort of the bottom line from your email, Marty, and I'll pull that up at least to share, and then you could speak to it. But I think everybody can see this page. It's noted here in the number 4. The committee did ask the Bureau to look at whether the current rating factors meet the requirements of LD 1331. And they looked at it, and it looks like all of the carriers would already meet the first requirement of not exceeding 1.35, and only Harvard and Community Health Options would have to adjust their factors to meet the 1.25% requirement. And then just this information about the potential impact on rates. I'll let Marty speak to that, but.
Yeah, so we do collect data on by geographic area, we do have premium that's collected. So we used, I'm trying to remember what year we're in. We had 2020 data that had just come in from the carriers. So using that and calculating a weighted average, if we took the reduction due to the restriction on the geographic area, it decreases the premium collected by about 5 or 6%. And then that would be spread amongst the other geographic areas, and that would increase by less than 1%. So that doesn't take into account age rating. That's just looking at a weighted average premium. So it's a pretty rough estimate, but that's as we understood the question that was being asked.
Yep.
And that was basically true for individual and small group. Small group, the data wasn't quite as clear. We do have some small groups of business for some carriers.
Sorry, say that again. For small group, the data wasn't as clear. Is that what you
Yeah,
said?
there's some carriers that don't have as big a block of business. So it was a little bit more difficult to determine. But like we said, it was really Harvard and Community Health Options that had the higher geographic rate factor. The other carriers had already had a lower factor.
Okay. Great. I am not finding that information had to have been circulated to the committee, Colleen.
Yeah. And I sent it yesterday, and it was a large document, so it could have been that issue. I'll resend it. And part of I couldn't save it or upload it because it was some of the attachments and spreadsheets were large. So I'm going to resend it again.
Okay, that would be helpful to me. Can you stop screen sharing for me?
Yep.
All right.
Forward it again right now.
So we're in a situation where the sponsor is not with us, and we've just received new information that I actually wasn't sure we were going to get today. I thought we might have to wait until next session to have this information. I wasn't sure what level of detail Ms. Hooper would be able to pull together so quickly. So, and I'm actually still not sure what level of detail because I haven't seen the actual email. So I'm inclined to table this bill and pick it up once we've had a chance to digest the information and discuss it amongst ourselves and really look over the spreadsheet and so forth. But again, don't want to make a premature tabling motion as it's not debatable. Does anyone else want to comment on the bill or ask Ms. Hooper any questions at the moment? Okay, I am going to move to table. Is there a second? Seconded by Representative Connor. And all those in favor, put your hand in your window, please. Representative Arford, your hand is always hard to see because you have a fake background. Okay, great, perfect. All right, so it's unanimous of those present to table, and we thank you for your quick work, Ms. Hooper, and we'll try and review that once we actually get a hold of it. Okay. Next,
I'll send it in separate attachments. Maybe that was the issue for some of you. It might have been
maybe
too
it
large.
was too big.
So yeah, so I'll break it down and resend the information to everyone once we finish up. So thank you.
Okay.
Sorry about that.
All right, perfect. Yep, thanks. Okay. So the next bill is LD 1196. And I don't know if the sponsor is with us. I don't know if he was planning to be with us.
I think he is here.
Oh, he is here.
I see
Perfect.
him in the attendee list.
Oh,
Yep,
there he is. He's under rep rather than Sam.
Oh,
so that's
R,
why I couldn't
yeah.
find him. All right, perfect. We'll
So you
pull
may
him
want to hear
in.
from him as opposed to
Yeah,
me.
I would like to hear from him. We can send Ms. Hooper back through the wormhole, and we can pull Mr. Representative Zager in. Good afternoon, Representative Zager.
I've been watching. You guys have had quite a day.
We have, and we've got like 10 more bills to go after you. So that's good though. We're voting. We're doing it. We're doing the thing. So Representative Zager, thank you for joining us today. You and I have had some conversations about this bill, and I was hoping that you could kind of summarize where those conversations and what you'd like the committee to do.
Gladly. First of all, thank you so much. I'll be brief. Indeed, I think it was a very productive hearing. The thing that everyone seemed to agree on, no matter what they were testifying for or against, or neither for nor against, is that the status quo is not acceptable. We can't continue to spend as much as we're spending and have shorter lives, nevertheless. So I'm proposing that this be tabled with the committee sending direction to stakeholders to essentially workshop it some more. That it would be the stakeholders group would meet or be convened by the Maine Medical Association. I've discussed this with Dan Morin, and he's very much in favor of that. The thinking being that the Maine Medical Association represents all specialties in Maine and all practice settings in Maine. The committee could also send, if it sees fit, instructions that this working group come up with a proposal that focuses or orients our system towards, number 1, prevention, 2, chronic disease management, 3, access and equity, and 4, treatment for behavioral mental health conditions such as substance use disorder. And also that the proposal that emerges from the working group help us move towards a value-based system away from fee-for-service. There's more that I could say about that, but does that give Senator Sanborn, you and the committee, a sense of where the conversation is at this point?
Yeah, absolutely. And I appreciate that. I think it's attentive to some of the questions and concerns that were raised at the hearing. Particularly you and I talked about the need to ensure that greater utilization of primary care is what's incentivized rather than merely greater spending on it. And trying to figure out those value-based payments as opposed to just a sort of ramping up of fee-for-service into primary care, and a real focus on sort of management of disease and of sort of health were the things that we had chatted about, and also making sure that it was a full stakeholder process. I think what Representative Zager and I talked about was carrying the bill over in order to allow for those discussions to take place not during the press of the last 2 weeks of our committee work, but instead during the interim. Then sort of sending a letter from the whole committee, hopefully, sort of talking about what we just talked about, what Representative Zager just outlined, and outlining some of the stakeholders, not maybe an exhaustive list, but some of the stakeholders that we would really like to make sure are invited to participate. But it would just be a suggestion because we don't have the legal authority to order the MMA to do anything, but a suggestion from the committee as to what would be helpful for us in our work going forward in the second session. Colleen, we've got some notes. Representative Zager's got some notes on sort of some of those folks, but I think some members of the committee wanted to weigh in about who those stakeholders should be who were involved as well. Representative Arford, do you want to chime in?
Sure. Thank you so much for recognizing me. And thank you very much, Representative Zager, for both your bill and for being with us today. I have looked at your list. It's quite exhaustive, but what I saw missing, which is actually a very common practice in a lot of our transformation work, is patients. And I would like to see at least a good representation of patient representation, a patient safety advocate, a patient experience advocate, someone who would represent the interests of patients without having to bring any other interests to the table with them. And I'm also curious as to whether or not, and we did talk just a bit about this, the purpose, is there yet a charge for this group, or is that something that will evolve? That's a question, I guess, that Representative Zabel, you could address.
Sure. Representative Alford, I think it's a great suggestion. I fully support it. About ensuring the voice of patients who have no other interest. Obviously, we all are patients, and so forth. And groups like Consumers for Affordable Healthcare certainly have the patient in mind. But I think your suggestion is great. As far as a charge, I think that I would suggest it be twofold. One is that have end state parameters. In other words, Oregon said 12%. Rhode Island said 1% per year. We could, as a state, could say something that is not just, works towards utilization, to Senator Sanborn's point. So number one would be end state parameters that the working group would suggest to this committee, and number two would be a timeline for getting there. That we need to recognize that we just can't keep saying, oh yes, this is important, we should get to it at some point, but we need to, I believe, say that by a certain date, we will get to a certain end state, which this working group can recommend to this committee, and this committee could put into LD 1196 as it sees fit.
The other suggestion, and this isn't the time for this conversation, a lengthy conversation, but I would also suggest that outcomes be the focus. We could get lost in utilization and over-treatment and over-care. And so I would also ask that you look at outcomes of care, that's what the goal is, better outcomes at a more reasonable price. And so I think that's critically important. And then the last thing I wanted to add was the notion of patient-centered care. If you could add that to your list of objectives, that would be appreciated. And thank you again for doing this.
Great. I concur. And with regard to outcomes, I think that the way I was phrasing that was that value-based, because outcomes are part of value-based modeling. But I see no harm in being explicit if the committee saw fit in its letter.
Thank you.
Okay. Are there any other comments on the bill? And then, Colleen, do we actually vote? We haven't done a carryover this year, so I think the motion is actually to carry over. Is that right?
Yeah, we do make a motion to carry over, and then presumably at the end of the session or close to the end of the session, the presiding officers will ask for a list of those that have been carried over. They ask for the votes on the committee to be noted. So it's not an official report, but we do keep a record of it and do a formal motion to carry over.
Is there anyone on the committee who objects to the letter in any way or has concerns about that? Okay, Representative Tepler.
Thank you, Madam Chair. I was just going to move to carry over this bill, LD 1196, to the second regular session of the 130th legislature.
Been seconded by Representative Quint. Is there any further discussion? All right, all those in, no, we need a roll call. Yeah, go ahead and do a roll call.
Representative Quint.
Yes.
Representative Quint, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson. Representative Matheson is absent. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 11 yes, 2 absent.
Okay. Thank you very
so
much,
much.
Representative Zager.
Thank
And
you very
we
much,
look
Madam
forward
Chair.
to seeing what we can do with this next year. Thanks.
That's right. Thank you so much.
The next bill is LD 1258. This is the committee's bill on ambulance reimbursement. I don't think we need a work session on it since we've sort of worked these issues a couple of times, but I do think there's some comments on the bill. So I guess I'll just open it up to the committee for comments. Representative Morris.
Yes, thank you, Madam Chair. As we know, this was an extensive stakeholder process, and as we are okay with the bill as is, except we would like to see a sunset review at some point on the certificate of need for ambulance services, and a lot of that deals with, as demographics, people move around, demographics shift. Some of the communities might want an ambulance service, and I don't want to make it too much of a burden on a community that wants to start a new ambulance service. So I would say that I understand we don't want to completely mess up all the work that was done over the summer, but I do think that that's something that we would like to see inserted in the bill.
Representative Morris, can we put a 5-year sunset on it? So it's 5 years out from the date that we passed the bill? Or, I mean, we can pick a date certain, but that it's 5 years away. Okay.
Yes.
All right. I think that we can go along with that. It gives the legislature some time to get some cost data back and get things up and running and into sort of phase 2 of the process before we upset the apple cart on the delicate balance that was negotiated. Yep. So I appreciate that. Representative Tepler, go ahead.
I was going to make a motion if we're ready for one, Madam Chair. But I also want to mention that Representative Melorano is having some difficulty with her internet as well, but hopefully she'll be back on soon. My motion would be ought to pass as amended with the addition of a sunset that is 5 years hence. And on the CON portion of the bill. And that's, I think, it.
Yep.
And
Representative Evan.
Oh, sorry.
A second.
Representative Evans seconds. Representative Tepler, did you want to add something?
Yeah, I want to say that I thought the work that this group did was extraordinary. It's very unusual that you send a stakeholder group out to do work and they come back with such a well-reasoned, extensive piece of work as the report back was for this. And, you know, I think the committee really thanks them for their hard work.
Yeah. And it's too bad that Representative Zager isn't with us anymore. Perhaps Mr. Moran is, I don't know. But I certainly, if the primary care working group that just got suggested could produce a product that was, you know, as good as this one, we would really move this state forward, I think. So kudos to all of the folks who worked so hard to pull this consensus set of recommendations together. And I'm pretty proud that Maine is going to enact this piece of legislation. So good work, everyone. Colleen, what are we forgetting?
I just wanted to clarify that there was a technical amendment too that was needed to the bill that I'm assuming Representative Tepler would incorporate, which was to correct a drafting error. So that will be part of the motion. I just wanted to make that clear to folks who might be listening and might be concerned that that clarification would not be included. So.
No, I would like that clarification included, and I believe Representative Evans would as well.
Yes, great. Thank you.
Great. Okay, so I don't see any other hands up, and so I think, Christian, you can go ahead and call the roll.
Representative Quint.
Yes.
Representative Quint, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson, absent. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melarano. Representative Melarano is absent. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler. You're muted.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 10 yes, 3 absent.
All right, we've been going for almost 2 hours and 45 minutes. Kind of shockingly, time went by very quickly, at least in my lands. So I'm going to suggest that we take a 15-minute break at this point and come back at 4:45. So I guess that's a 20-minute break. But that we come back at 4:45 and then try and power through a few more of these. I am actually going to take the chair's liberty of suggesting that we skip a couple that I think are going to be a bit longer conversation and move up a couple that I think might be shorter conversation. So I'm going to suggest that we're going to skip 1266 and 1268. 1268, the sponsor is not here. That's Senator Stewart. And I think we might be able to get through the rest of the bills if we skip those two. If we don't skip those two, I don't think we'll get through even those two maybe today. So I think in the interest of efficiency, that might be the best way to go, to pick up with 1239.93, excuse me, when we return, and then 1311, 1450, 365, and 1544. And my apologies to the folks who were waiting for the dental bill or were waiting for the serious mental illness bill. We're gonna likely not get to those today given the late hour, but I think we can complete the rest of our work if we skip those. So if that's okay with everybody, I'm seeing some nods, so I apologize for that. I hate to postpone work sessions, but we are going to have gotten through a lot, I think, today if we can get through the remaining bills that I just listed. So with that, we'll be back at 4:45.
Okay, it is 4:45. Got a lot to do. Hopefully folks can hear me and are headed back this way. We are going to start by taking a tabling vote on the two bills that we're going to skip over. Just for bookkeeping, record keeping information. Helpful. We've got Representative Blyer in his car. All right, try it. Be careful. All right. Okay, so I will call a tabling, make a tabling motion on LD 1266. And Representative Tepler, did you want to second that? Great. Okay, and if all those in favor who have their cameras on or can safely put their cameras on would just raise their hand in the window. Representative Evans, is that okay? Yeah. Okay, Gina, Representative Melrano, tabling motion on LD 1266. Yeah, okay, it's unanimous of the ragtag bunch we've got present. And next I'll make a tabling motion on LD 1268. And it's seconded by Representative Tepler. All those in favor, please show your physical hand in the window. And that's unanimous of those present. We got everybody on camera that time. All right, so the next bill we're going to work is LD 1293. This is not a bill we have worked before, I don't believe. So Colleen, I will have you do your presentation.
Thank you. Share this. I think everybody can see this now. This is LD 1293. It's an act to improve access to certain injectable medications for the treatment of mental illness and substance use disorder. As it's drafted, the bill would permit pharmacists licensed within the state of Maine to administer to adults injections of drugs approved by the Food and Drug Administration for the treatment of mental illness and substance use disorder upon the order of a licensed practitioner or as part of a collaborative practice agreement. Proponents noted that the administration of this medication by pharmacists may improve access to medication and adherence to treatment for persons with mental illness. It will alleviate the need for patients to fill a prescription at a pharmacy and then return to a provider for administration of the medication, which is what often happens now. As drafted, the bill would require the administration of the medication to be upon the prescription drug order of a practitioner or pursuant to a collaborative drug therapy management program. So it doesn't remove the physician or the healthcare practitioner from the prescribing of the medication. It would just allow the authorization to the pharmacist to administer that medication as part of the drug order or pursuant to the collaborative drug therapy management program. As drafted, the bill adds to the definition of the practice of pharmacy, the administration to adults, as I mentioned, to inject these drugs that are approved by the FDA. Under current law, pharmacists are authorized to administer vaccines and emergency drugs like epinephrine by injection. The bill would require pharmacists to complete the same certification that's required for the administration of drugs and vaccines. You did have some testimony at the public hearing asking you to consider from both the Maine Pharmacy Association and Equality Maine, consider an amendment to the bill that would allow pharmacists to administer all FDA-approved injectable medications if requested by a prescriber, rather than only those for substance use and mental illness as allowed under the current draft. This expanded authority would provide the opportunity to administer other current medications such as long-acting birth control, and also may any future injectable medications that may be approved. And we talked about the possibility or the injectable PrEP medication as part of your discussion of LD 1115 that you voted on earlier. So that's another authorization that might be included if you amended the bill. Maine Health suggested amending the language to reflect that long-acting injectable therapy used to treat mental illness should not be modified or discontinued by the pharmacist without the approval consultation of the patient's behavioral health provider. The Maine Medical Association suggested that you consider an amendment requiring the initial dose to be administered by the prescriber, rather than the pharmacist. The Maine Osteopathic Association suggested in their testimony that language be added that administration of these medications by pharmacists is acceptable only when a qualified mental health or primary care provider is unavailable. And then I did want to note that earlier this session, you may recall, you considered legislation LB 603, which was voted on by the committee with a divided report, but that bill, as drafted, amends the definition of the terms pharmacist and the practice of pharmacy in the Maine Pharmacy Act to specify that it includes the provision of healthcare services. That bill also requires the Board of Pharmacy to establish specifications for administering medications, drugs, devices, or other materials within the practice of pharmacy. So that requirement for the Board of Pharmacy, if LD 1293 went forward, either in its original form or an amended form, would encompass that authority, that directive to the Board of Pharmacy to establish specifications around administering these types of medications. And lastly, I wanted to point out that the initial fiscal note, preliminary fiscal information we received from the Office of Fiscal and Program Review does indicate that there will be some costs to the Board of Pharmacy to implement the requirements of the bill. Their initial estimate is that they may need some additional staffing. So there's a suggestion that an allocation be provided to support one half-time position and related all other costs to manage the increase in applicants for certification, as well as the investigation of any complaints. It is an allocation of other special revenue funds. It would not require a general fund appropriation, and the information suggests that the department or the Office of Professional and Occupational Licensing will transfer funds from its licensing and enforcement program, which includes funds for the Maine Board of Pharmacy, to the Administrative Services Division to fund these allocations. And they've also indicated that they believe they have sufficient resources to support the costs of the bill without raising fees through this biennium. But there is a potential for fee increases in future biennia if the current fee structure doesn't generate sufficient revenue. So I wanted to point that out. If the legislation does move forward, an amendment would include the allocation authorizing this additional half-time position. And I'll stop there. You also have, I believe, still in the room, folks from the Board of Pharmacy, if you have any further questions about LD 1293 or the preliminary fiscal impact information.
Great. Thanks, Colleen. So there wasn't any testimony in opposition to this bill. And the real question, I think, is whether we limit it, as the sponsor, I think, modestly said he was sort of an incrementalist, or whether we expand the scope of it to include all FDA approved medications. And I'm certainly on the side of expanding it to include all FDA approved medications. This requires a physician's involvement anyway. It requires, a prescription written by the treating prescriber, and also that the prescriber actually coordinate or communicate with the pharmacy on the administration piece. And I think it's an access to healthcare issue, and particularly in rural Maine, where pharmacists might be much more accessible than primary care doctors or treating physicians might be. So that's my leaning on this. Representative Tepler, go ahead.
Thank you, Madam Chair. My only concern as we review this and talk about it again is the fact that a lot of our pharmacies in southern Maine are understaffed, or are staffed in a way that means that the pharmacist's time is always a little stretched, and whether there's anything we can do about that within the scope of this bill, or indicate something about whether or not we want some report back about staffing and how that's going, because I am concerned just that particularly if we allow the administration of the psychiatric medications, will someone then have to stand in line at a pharmacy to wait to have their psychiatric medication administered? And how long will that wait be? That's, I guess, my only fear. Now, recognizing that we're also stretched with primary care physicians and other providers as well, but I just want to bring that up as a concern as I think about it.
Okay. I mean, we do have 2 schools of pharmacy in Maine. And so, which is great. I think it's, the possibility of having adequate employment, workforce development, because we do have those educational resources. I think this is voluntary as well. Like,
I was going to
Colleen, can you speak to that?
Yes, it is voluntary on the part of the pharmacist, and in order to participate, they need to go through the certification process with the Board of Pharmacy.
Okay.
So it wouldn't be a requirement, certainly. It could be an individual decision made, pharmacy to pharmacy is, maybe considering those staffing issues you raised, Representative Tepler, as to whether or not they would participate in this.
So if I could just follow up for a second, Madam Chair. Thank you, Colleen. So I guess then I would envision that a pharmacy might have one pharmacist who is specifically trained in injection, and that person would be the person who would be available, hopefully, to administer the medications.
Yes,
Okay,
the only pharmacists that go through that certification would be allowed to do this. And then further, it has the requirement that it be done pursuant to an order of physician or a licensed practitioner or a collaborative practice management agreement.
Yeah. Senator Brenner. You're on mute.
Sorry, I clicked the hand button instead of the mute button. Thank you, Madam Chair. I am 100% behind this bill. I think it is getting right to the root of some of our access issues. I'd be happy to move the motion with the amendment.
Okay, it looks like Representative Evans has seconded the motion. I guess I would just also comment, if you're picturing like your Hannaford pharmacy and think that's a weird place to get a shot, I was amazed to learn when I got my vaccine that there's like a little side room off to the side at a lot of these pharmacies where you can have private consultations. So I had no idea until I happened to be in a Shaw's getting a COVID shot. All right. Is there any further discussion on the bill? Representative Tepler, go ahead.
Thanks. And I just want to mention that my Hannaford pharmacy has one of those little rooms, and I've received a Shingrix shot in one of those little rooms. So
Right.
yeah,
We've all gotten jabbed.
And well, the COVID came differently, but I'm with you on this as well.
Okay. Are there any other comments? All right. Seeing none, we'll have the clerk call the roll.
Representative Quint.
Yes.
Representative Quint, yes. Representative Connor. I'm sorry, I couldn't hear your mic there.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson. Representative Matheson is absent. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That is 11 yes, 2 absent.
Okay. The next bill is LD 1311. And this is Representative Evans' bill on the State Employee Health Commission. And Colleen, I think I'll have you do your presentation.
Okay. Real quickly, this is, as Senator Sanborn said, it makes some changes to the laws governing the State Employee Health Commission and the State Employee Health Insurance Program. It corrects some nomenclature. The name of the title has changed from the Division of State Employee Health Insurance to the Office of Employee Health and Wellness, and it also changes the name of the office head to reflect the current name, which is the Executive Director of Employee Health and Wellness. It states that the duties of the State Employee Health Commission include providing counsel to the Executive Director and the Director of the Bureau of Human Resources on dental insurance and the State Living Resources Program, in addition to the the group health plan. It also specifies that votes of the commission must be unanimous for action to be taken. And it provides that administration of the State Employee Health Insurance Program must be consistent with actions taken and counsel provided by the commission. Under current law, the State Employee Health Commission serves as the trustee of the group health plan and advises the Executive Director and the Bureau of Human Resources on health insurance issues and the Bureau of Human Resources on issues concerning employee health and wellness and the Employee Assistance Program. It has 24 members that are set forth in statute representing labor and management, and membership is specified in statute in terms of who those labor and management members, the constituency that they represent. The commission's co-chaired by a labor member that's selected by the labor members of the commission, and the management co-chair is the Director of the Bureau of Human Resources or the director's designee. And then votes of the commission by statute are required to be cast by one labor vote and one management vote. And as a result of that, consensus is needed for decision-making of the commission. The bill was brought forward by labor representatives on the commission with the intent to clarify the role with regard to the administration of the health plan and to, in their opinion, remove ambiguity related to voting in the event of a tie. Their testimony noted the potential for management to disregard actions of the commission. However, you did have some testimony in opposition from the Department of Administrative and Financial Services. They felt that the legislation was not necessary as the commission functions well and there's little to no conflict among the labor management members. They've always been able to work in good faith to reach consensus as required to take action. They noted 3 primary concerns in their testimony. Requiring a unanimous vote might be used as a means of obstruction in the future. And if that has the potential to cause delays or incur costs or failure to deliver services, that's something that DAFs would be concerned about. Secondly, the language in the legislation replaces a reference to rules adopted to actions taken and counsel provided. And they suggested that that is a movement away from sort of the well-established Administrators Procedures Act provisions related to rulemaking to something that would be less structured and less formal in terms of its guidance. They suggested that if they want to change or alter their instructions, that they would prefer it to be done through rulemaking. And then lastly, they believe the changes could give rise to situations where labor would be at odds with the legislative directive that DAFs has been tasked with and might prevent DAFs from carrying out their statutory responsibilities for administering benefits. I did want to note that although the current law includes language requiring the administration of the program to be consistent with rules adopted by the commission itself doesn't have any specific rulemaking authority in Section 285A. So that's something that if the committee doesn't adopt the changes as proposed in the bill, you might consider adding that specific authority. I did want to note that there is one currently adopted rule that governs sort of adjudicatory proceedings of the commission after an appeal. So it sets forth sort of the guidelines and the process for those appeals, but there are no other rules related to the commission. And I'll stop there, and I'm happy to answer any questions. I do think we did have, I'm not sure if Ms. Trundy is still here, but she was here earlier. She may be here to speak to specific questions about the commission. You also
She
have
is
others
she
as
is
well.
here. She is here, and I'll bring her in as well as
Mr. French is also here. Who I believe
Mr.
is the
French
chair of the
Yeah.
labor members. Yep.
I'll bring
I
them
think-
both in.
I think Mr. McCabe may be there as well.
Yeah, I didn't see Jeff, but he might be.
He is there. I don't know. Do we need to hear from both Mr. French and Mr. McCabe, or can we just hear from one of them? Representative Evans, it's up to you.
It might help to hear from both of them, if you don't
All
mind.
right, let's bring in Mr. McCabe, and we'll try and be quick about this.
Yeah.
Mr. McCabe, Mr. French. I think Mr. French is in the wormhole at the moment and may have gotten stuck there. And I see Mr. McCabe and Ms. Trundy. Thank you for joining us. There's Mr. French. Okay, so we're trying to understand what problem this bill is trying to solve. I'm going to direct that question to Mr. French because I gather from Ms. Trundy's eyebrows that she doesn't know.
Sure, it's basically protecting, as I testified earlier, it's protecting the value of the commission. As noted in that last piece, essentially the only thing that basically protects that value in statute and gives the commission the value that it does to make the decisions that it does for not only the state employee health plan, but the health and wellness of Maine citizens in general, and the work that we've done, is that rules adopted by the Health Commission. However, as specified, the commission has no rule of making authority, so therefore in statute currently, there's nothing that ties what happens at the commission to employee health and wellness. So that's kind of the bigger, that's kind of the picture. What we're looking at is we've got a great relationship now, and it has worked. We've had issues in the past where we have had, the question of what would happen if there's a potential tie vote. However, that particular piece of it is that there's really nothing that if there was a tie vote, for one, there's nothing saying what happens. And two, if there is a tie vote, there's nothing that ties whatever happens at the commission to what's happening via DAFs. So that's kind of the concern. And by having this language, now the council provided the actions taken by the commission, DAFs would have to be consistent with that action as it is now. The question about the rulemaking, I think if the commission were to take on the rulemaking process, the timing of that would pose really issues as far as our process and how we do plan design and get that out in a timely manner. There's only so much time that we have to meet and to get that work done. So rulemaking may really slow down that process and not allow to meet those deadlines. So I can see why the commission actually doesn't have the rulemaking authority. However, as I also want to point out too, the Bureau of Human Resources director and also the director of employee health and wellness both sit on the commission. So they have an input into the process, which is essentially given to them to oversee. So they have direct input into it. And lastly, there was a question asked about if there's no consensus, I think, and potentially holding up things. The beauty of the design of the commission is that everybody on the members of the commission are members of the plan. So they are directly affected by the action or inaction of the commission. So that's another reason to push toward consensus. So, I don't see a situation where labor would hold anything hostage because labor is going to feel the direct impact of any of those fines or missed deadlines or anything like that. So the commission's already designed to set it up, to push toward a consensus. This bill would just make sure that that value is intact, that DAFs would need to follow basically the direction of the commission as they do now, because that's the understanding and the working relationship that's there, even though it's not in statute.
Okay, thank you, Mr. French. I'm still not sure I see where we have a thing that's broken that needs fixing, but I appreciate your effort. Mr. McCabe, do you want to try and show me what's broken that needs fixing?
Yeah, I appreciate that, Chair Sanborn. For folks, Jeff McCabe, I serve as a political and legislative director for Maine Service Employees Association. A few years ago, we actually ran into a situation where it looked like the Health Commission was headed towards sort of a stalemate in a possibility that there might be sort of a ruling or what we felt was sort of an overreach of the folks that were representing the administration. We came to a meeting as an organization. We brought in some of our labor representatives and had a very heated discussion with sort of the current administration about some concerns that we had, some directions of the commission. And it was the first time that we had sort of had that type of meeting in my professional career with the organization. And it was clear, we had a commitment from DAFs at that point to sort of iron out some of those relationships. There were some staffing changes made at the commission, and there was some sort of reassignments of folks. And since then, we have sort of been in a pattern where the consensus has worked. So that was a moment where it was very uncomfortable for a lot of us because there was sort of direct political influence over the commission. We stepped in as an organization with some coordination with some of the other organizations and some of the other labor representatives there. And at that point in time, Mr. French by trade is an engineer and very much about details and sort of process, and thought that this might be a way to sort of address that. I think for us as an organization, we saw this as an opportunity to come forward to the committee to bring this concern and sort of work through it. Also, for us, we're used to dealing with other committees within the State House, much more sort of political engagement, show of, our members reaching out, but we recognize that you folks deal with a much more technical nature of things. So we figured that we would sort of broach this bill through, having one representative testify, offering myself during the work session, and sort of just moving this forward. The information provided by the analyst today in regards to rulemaking was helpful because that was something that was not necessarily clear to us when it was raised during the public hearing. With that information, some of the other information, as well as some of the agreements I think we all have around the nomenclature needing to be sort of updated. I know you're all under a compressed time frame, and I'd be happy to work on this outside of this work session with the department just to see if there's language that folks could live with, and even come back to the committee next week and figure that out. But I think for us, we understand the concerns the state have. We also do have concerns. This is very much nothing necessarily about the past, but really just looking towards the future and trying to head off any issues that we might have. So kind of an uncomfortable, subject, I think, for a lot of us to talk about, but we see this commission as really a model, and we want to see it succeed. We think it works. We just want to head off any future issues. And I've tried to say, it's not necessarily about the current staff, the current makeup of the commission, but it's really what could happen in the future. And that's what I think we're most concerned with.
Okay. Ms. Trundy, can you respond to Mr. McCabe and Mr. French's comments?
Yeah, I mean, I think that our concern here, to be entirely frank, is that this is the proposals are just two sides of the same coin, I think that, while the situation that Mr. McCabe describes may have been uncomfortable, it did ultimately resolve as we would hope that it would resolve. And we still do have, we have a concern about not being able to carry out DAF's duties as they have been put forth in budgets and in legislation. And if we were to flip to the other side of the coin, and one of the other things that I did raise in my testimony and this is meant to be no disrespect to those who participate on the commission, but there's a lot of technical expertise in that goes into this matter, and the commission meets for a couple hours a month. Attendance, not everybody attends, and there's a lot of turnover within the commission. And so I think that, the reliance and the deference to the staff with years of technical expertise in administering health and benefits is appropriate.
Okay. Representative Evans, do you have comments? This is your bill.
Yeah. My question would be, is there any way that you can find common ground in this area? That would be to all three.
I think that to speak for us, we'd be willing to look at the rulemaking authority. I did not realize that the commission didn't have the rulemaking authority, because the thing that I checked for was to see whether there was any existing rule. And I found that existing rule and just made an assumption that then the commission had done rulemaking in the past. But if that authority is something that needs to be given to the commission, I think that would that is probably appropriate.
Okay. Sorry. The Honorable Mr. McCabe, go ahead.
Thank you, Madam Chair. I would be more than happy to work with Ms. Trundy in the department and Mr. French. Ms. Trundy and I go way back. We find ourselves in this situation more often than not. And usually we can come to some sort of consensus. And if not, we're also able to admit to a committee that we can't come to consensus. So I think we would be willing to work and try to figure out where there's some common ground.
Representative Tepler.
Thank you, Madam Chair, and thank you for being here, Ms. Trundy, Mr. McCabe, and Mr. French. I guess one question I would have is about this rulemaking authority. Would it enable the commission to make its own rules about attendance, for example? And some of the other concerns about health and wellness that Mr. McCabe and Mr. French have addressed. Would rulemaking authority help take care of that?
I mean, I think it certainly could. I mean, when I mentioned the rulemaking authority, the commission is set forth in section 285A of Title 5. And that's where it lays out sort of the guidelines for the commission, the membership, and all the rest. And there's not a specific statutory subsection there that says the commission may adopt rules. Even though there's a reference in the other section that is removed in the proposed legislation that refers to rules adopted by the commission. So that may or may not, that was sort of the reason why I raised that as an issue. And that may be an opportunity. Of course, it would tie the commission to having to conform with the APA requirements for rulemaking. And it may take time, but that is something that might be worth considering.
Okay, in the interest of time, it's already 5:15. Ms. Trundy and Mr. McCabe have indicated a willingness to talk to each other about the rulemaking piece of this. And, I think there's potential appetite for that if there's some things on which rules could be made, but other things on which, just quick decisions, advisory board actions are taken or whatever, then that might be some language to be hammered out. I will just tell you before I send you off to talk to each other some more that I'm not that excited about the idea of requiring a unanimous vote as opposed to the consensus process that's currently in place. But if there's other things around the rulemaking stuff, then I'm certainly open to language on that. So are there any questions or other comments from the committee All right, I'm going to
I
move to
would-
table. Oh, go ahead, Representative Evans.
Oh, I'm sorry, Madam Chair. I was going to say I would agree with your assessment.
Okay, great, thanks. I'm going to move to table. Is there a second? Representative Quint seconds. Everybody can put their hands in the window if they agree to the motion to table. Representative Arford, are you with us? Great. Okay, it's unanimous of those present, and thank you for joining us, Mr. McCabe, Mr. French, Ms. Trundy. And the next bill that we'll pick up is LD 1450 regarding communications from PBMs. We'll go over the analysis really quickly, but also mostly just look at, I think that, or maybe we should just look at the amendment instead of the analysis in the interest of time, Representative Tepler.
Am I muted or I can't?
No, you're not. Go ahead.
Good. There we go. I was looking for my button. Yes. In fact, I believe Colleen is prepared to do that. She and I discussed that during the break. So rather than going through a full analysis, she'll take a look at the language. Were you able to find it, Colleen?
Yeah, I'm gonna.
Okay.
I'm gonna try to share my email. Do you
Yep.
see that? Do you see that?
Yep.
Is it big enough? Okay.
Yep.
I'll try to make it bigger, but this will work. I'll try to make it a little bigger, but you can see this language. This was language that was shared on behalf of PCMA, representing pharmacy benefits managers. But my understanding is that this would be a proposed amendment for the committee to consider to replace the bill. And it would be simple, straightforward sentence that would state that pharmacy benefit managers or representatives of pharmacy benefit managers may not, we use may not instead of shall not, so I changed that, cause or knowingly permit the use of any advertisement, promotion, solicitation, representation, proposal, or offer that is untrue, deceptive, or misleading. My understanding is that this is a suggestion to incorporate this provision consistent with language that's in South Carolina law. So I'll stop sharing, and I think that's the idea.
Great. And so we have Representative Tepler. We've heard from Mr. Lanton that he's fine with this amendment. Is that the case?
Yes, it is. Mr. Lanton, I believe, is with us, though, if we wanted to bring him in to say anything.
As long as we don't have any questions, I would rather just go straight to a motion in the interest of time, unless anybody has any questions specifically for Mr. Lanton. Representative Morris.
I was just going to make a motion not to pass this amended, but if folks do have a question, I'm certainly, willing to hold off.
I don't think anybody does. So ought to pass as amended. Is there a second? Representative Senator Brenner has seconded. Great. So we have a motion and a second ought to pass as amended. Is there any further discussion? Seeing none, the clerk will call the roll.
Representative Quint.
Yes.
Representative Quint, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Yes.
Representative Morris.
Mark doesn't get to vote for me.
Representative Matheson. Representative Matheson is absent. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That is 11 yes, 2 absent.
Great. We have 2 bills left, everybody. We're going to get through everything. So before we move on to the next bill, Representative Melorano, if you want to cast your vote on LD 1258 now, we can do that now, and then we'll move on to LD 365.
And that was the ought to pass as amended ambulance bill. And
correct.
Vote is yes, please.
Great.
Thank
You
you.
will be recorded as such. Thank you. All right, so the next bill is LD 365 on consumer credit reporting for certain medical bills. Colleen, why don't you go ahead and do your analysis?
Okay. This is LD 365. This was another concept draft, but the language was shared by the sponsor, Representative Morris, in advance of the hearing, and you took testimony on the language. At the hearing, as drafted, the bill would prohibit a consumer reporting agency from reporting debt from medical expenses on a consumer report for a collection account with a medical industry code if the consumer was covered by a health benefit plan at the time of the event giving rise to the collection. And the collection is for an outstanding balance owed for emergency medical treatment or treatment in a facility for an out-of-network benefit claim. There are some provisions in current law that relate to the reporting of medical debt. Consumer reporting agencies may not report debt from medical expenses when the date of the first delinquency is less than 180 days prior to the date the debt's reported. Upon receipt of reasonable evidence from the consumer, creditor, or debt collector that a debt has been settled or paid in full, the consumer reporting agency may not report that debt for medical expenses and shall remove or suppress the report of that debt on the consumer's consumer report. And then lastly, there's a provision that as long as the consumer is making regular scheduled periodic payments toward the debt for medical expenses, the consumer reporting agency shall report that debt for medical expenses on the report in the same manner as debt related to a consumer credit transaction is reported. The first two provisions reflect a settlement agreement entered into by the three major national consumer reporting agencies with Maine and 30 other state attorney generals. The last provision, which I noted about the sort of noting that the consumer is sort of current with making regular payments toward the debt, was enacted into law during the first session of the 129th legislature. As noted at the hearing, that is the subject of a lawsuit by the Consumer Data Industry Association. They've argued that this law and another provision that was enacted and considered by the Judiciary Committee related to economic abuse were preempted by the Federal Fair Credit Reporting Act. In October, at the federal district court level, Judge Singal did enter a judgment for CDIA, concluding that the state law was preempted that I just discussed. The state has appealed the decision to the First Circuit, and it's my understanding in discussions with the Attorney General's office that oral argument is scheduled in June on that lawsuit. So I think really the issue for the committee to consider is whether a proposal like put forward in LD 365 would also be considered to be preempted by federal law. The testimony that you did receive from the Consumer Data Industry Association did assert that they believe that the Federal Fair Credit Reporting Act would preempt state action in this instance. Their testimony and the testimony from the Bureau of Consumer Credit Protection noted the current legal challenge that I mentioned to the provision in current law related to medical debt. So I'll stop there and I'm happy to answer any questions. Not sure if Mr. Lund is here or someone from the Bureau is here, but I'm happy to answer questions or that you might have.
Okay. Are there comments or questions from the committee? Representative Tepler.
Thank you, Madam Chair. And with all due respect to the sponsor, and actually very much appreciating the intent of the bill, because, you know, I wish we could do this. I'm very concerned about enacting another bill that will lead to a major lawsuit. You know, I wish we had control over consumer credit reporting, but unfortunately, we're preempted on a lot of it.
Okay, are there additional comments? Representative Morris.
Thank you, Madam Chair. And I certainly do understand where Representative Tepler is coming from on that. I think certainly I know, and I was hopeful that maybe we could hold off on this, and I'll leave it up to the committee as far as waiting to see how appeals go, because as we also found out in the hearing, that the law in Texas that I base this on is being challenged in court as well. And as you know, certainly if that were to be struck down, I would certainly support voting this bill ought not to pass. I don't know, but at the same time, with all the other committee workload we have, I understand it's a difficult decision on this one.
Yeah. I had some concern about what this really covered after we passed surprise medical billing protections and balance billing protections as well. So I was a little bit unclear on whether the risk of the lawsuit and non-constitutionality kind of had enough benefit to it. Whereas I think the bill we passed last time around really could help a lot of people who were on payment plans. And then that's the bill that's being challenged in court now. So that's sort of why I'm on an ought not to pass posture, as opposed to let's wait and see what happens with the court kind of thing. And this just felt like not quite as great a solution as that other one. Representative Arford, go ahead.
Thank you for calling on me. Is this, I do not have the expertise to know the legality of this actual bill. And so I understand there's a court case. I understand the sponsor is interested in potentially postponing action on this bill till some sort of resolution comes from that court case. I actually think this is an excellent bill that would help people. I've always thought that sending people to the creditor because of an inability to pay healthcare, when generally is because they've lost their job and they're very ill and their family is struggling to provide for them and support them, is something that we need to do something about. So are there any other options? Is there anybody else that can comment on any other options for this bill other than an ought not to pass?
Representative Evans has his hand up. I'm going to call on him next. I don't have an answer to your question, Representative Arford. Representative Evans.
Yeah, thank you, Madam Chair. I don't have an answer for you either, Representative Arford, but the court case is probably going to go on for some time, and I don't know if that's something that we want to wait around for. None of us may be alive, so.
I don't know if it'll take that long, but fair enough.
I just, it's going to take some time. So I'm going to make a recommendation of ought not to pass.
All right, so Representative Evans has made a motion ought not to pass. I will just speak before I second the motion. I'll speak to the fact that we are limited in the number of carryovers that we can take. So I'm trying to use them very judiciously. So far, we've voted one, but we have a number of others that we're anticipating that we may need as well. And I think in quite bipartisan fashion, if I do say so. Predicting where we're headed. So I'm going to second the ought not to pass motion on this particular bill. Is there further discussion? All right, Representative Morris, go ahead.
Yes, thank you, Madam Chair. No, I will support the ought not to pass on this. I think it's as hearing the discussion, I think the issue isn't so much that this isn't a good idea or doesn't have merit. It's the predicament we kind of would find ourselves in with a potential court case. They're already the superintendent, and I know because I co-sponsored that bill last time, some of the concerns around that, and I do think we have enough strong things in our statutes dealing with surprise medical billing, and I think this is something that we can always bring back in the next legislative session if we determine it has merit. Or certainly I would encourage people to reach out to their congressional delegation to see if we can get a federal law around this. But I will support ought not to pass on the motion.
All right, Any further discussion? All right, seeing none, the clerk will call the roll.
Representative Quint.
Yes.
Representative Quint, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer is yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson. All right. Representative Matheson is absent. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Millerano.
Yes.
Representative Millerano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 11 yes, 2 absent.
Great. All right, the last bill on our list for today is LD 1544. And we'll have Colleen do her bill, and we haven't had a work session on this, have we? No, we postponed it. So we'll have Colleen do her bill analysis.
Okay. LD 1544, as is drafted, the bill would exclude the amount of state and local taxes and fees from the amount on which an interchange fee is charged for an electronic payment transaction, such as a credit card or a debit card transaction. We've had a couple of bills that have touched on the sort of the surcharge issue or the convenience fee or interchange fee issue that merchants pay related to taking credit card and debit card payments. The current law does generally prohibit sellers in a sales transaction from imposing a surcharge from someone who pays using a credit card or debit card. Although you'll remember and note that governmental entities are permitted to impose a surcharge for payments made by credit or debit card as long as the surcharge is clearly disclosed and does not exceed the costs associated with providing that service. Current law doesn't prohibit sellers from offering a discount or other incentive to use other means of payment. Couple of things to think about. Consider the impact of this legislation on the existing contractual relationships between merchants and electronic payment networks. There are some federal law requirements for debit card transactions. Debit card transactions, the fees are capped at 21 cents. And then based on your testimony, generally, as I understand it, the fees associated with credit cards can range from between 2 and 4%. With regard to this proposal specifically, you had a number of concerns raised about whether merchants and sellers have the existing technology to implement the requirements of the bill. What would the additional administrative costs be? Are there additional costs to payment networks to make this happen administratively and to operationalize it? And then what impact it might have on consumers if they are required to pay in 2 separate transactions. Although I think you've had sort of testimony from the Retail Association that it wouldn't have to be done in 2 separate transactions. It could be done sort of on the back end. But again, you've had other testimony from the payment networks saying it's not as easy as that currently. You have also testimony indicating that if the bill were implemented, you could potentially save approximately 34 to 35 million annually in swipe fees. 63% of transactions currently are paid with credit card or debit card based on their data that they indicated. You did also have some testimony from the Electronic Payments Coalition indicating that the cost of handling cash transactions is actually higher than the cost of electronic payments based on 2017 data. And then there was also a question that was asked at the public hearing about whether interchange fees are deductible as business expenses for tax purposes. You did get some information from the Credit Union League in response to that question. But I also wanted to note that there is an IRS publication that does related to business expenses that does indicate that credit card convenience fees when paid or incurred by the business can be deducted as a business expense. And then I just remind you, we did consider LD 160 earlier this session and LD, which was voted on not to pass, and then LD 800 addresses the ability of state agencies and departments specifically authorizing them to impose a surcharge or service fee for payments made by credit card or debit cards. And then we've discussed before, there is some legislative history around this issue. There was a recent Supreme Court decision that related to a New York statute that ultimately was remanded back to the Second Circuit and then later dismissed. So there hasn't been any really definitive decision made on this issue about whether or not prohibitions on imposing a surcharge for using a credit card or debit card are permissible. We don't yet have any fiscal information on this bill. And then I would just also note that I think there have been a number of additional information and letters that have been forwarded to the committee yesterday and today by email from both proponents and opponents of LD 1544. And I think there are a number of folks here in your room as well who have an interest in this bill.
Okay. As a courtesy to the sponsor, I will invite her to join us. Representative Sachs. Good evening, Representative Sachs. Thanks for hanging with us. You had asked for an extra week or so. Yeah, you had asked for an extra week or so to work on this bill. So go ahead.
Thank you all so much. I know that's been a long day. As Representative Evans said, you weren't sure if you were going to make it through last that long. Thank you for lasting this long today. You have had a bunch of additional information, most of which is conflicting, it feels like, depending on the point of view. The only clarification I'd like to make, looking at Colleen's very good summary, is much of what she talked about was surcharge fees. And I know you've had many surcharge bills before you. This is really different. This is a different approach than has been taken before because of that very issue. We wanted to have the conversation around the fees regarding sales tax, not whether you can impose a different surcharge fee upon use of card. I'd also say that there's nothing in this bill that would, from any trends that I've seen in any of the evidence for the Electronic Payments Coalition, talked about the handling of cash transactions. The consumer, of course, this is not impacting the consumer or the state revenues. That even though a cash transaction might be more expensive, like they said, 9.1% versus 1.2%, the consumer actually isn't going to be impacted. It's not going to change any behavior for the consumer at all. This is really for the retailers. Again, I was brought this bill by very small businesses in my town, in my district, both in Pownell and in Freeport. So I appreciate having the conversation around it, and understand that there are other folks that may want to speak to their testimony that they've provided you as well. So thank you for this opportunity.
Thank you, Representative Sachs. Are there questions for the sponsor of the bill? Representative Tepler.
Thank you, Madam Chair. And thank you for being here, Representative Sachs. Just a quick question. Did these small businesses indicate to you that the accounting changes that they would have to make to create this separation between sales tax and the fee to run, sales tax and the regular bill to run the fee separately, was something that could be done easily enough that it would actually save them money?
Neither of them brought that up as a concern to me. They really just mostly talked about, in fact, almost entirely talked about how the pandemic really has exacerbated this situation. And I think I brought up in my testimony, one is a service-based industry. They're a local vet hospital, very small. And because people are trying to be contactless and COVID compliant, have been using credit cards, whereas many of their customers may have used cash or check in the past. They're a little local business, but their fees have gone through the roof without seeing any additional revenue. So that was their plea to me, is what can we do? And so when I talked to the Retail Association of Maine, knowing the history of the surcharge and the concerns around that, wanted to try and find a different approach, because of course, federally, we can't set the rates, we can't set the debit card rate or the credit card rate, but here's something that we can do to have a conversation about lessening the impact for them.
Thanks, Representative Sachs. I do hope that you will communicate with them that that those fees are deductible from their taxes.
I will. Thank you.
Thank you.
Representative Arford.
Yeah, thank you very much for allowing the question, and thank you so much, Representative Sachs, for bringing us this bill and for being with us today. There has been a lot of contradictory testimony on this bill, and one of the things I'm trying to understand is the impact. We are talking about it, but just to hone in on it just a bit more, the impact for a small, Brunswick borders on Freeport. So for one of the, what we would refer to as mom and pop type businesses in Freeport versus one of the chains, do you have any sense whatsoever of what the annual savings might be for a smaller business? Did any of them speak to you about what they would expect for savings if this bill was to pass?
They didn't talk to me about it directly. I know the Retail Association of Maine is here, and perhaps they represent many small businesses here in Maine. So, and they had been definitely a great resource in putting this bill together. So, with the chair's discretion, I'd certainly invite them to speak to that issue.
I would love some sense of that from someone who actually has some knowledge of it from the point of being an expert on this subject.
Okay. Well, from the point of being an expert on the subject, I don't know if a retail association lobbyist is an expert on calculating credit card fees. I've shared that I think I went back and looked in my business with about $2 million of receipts or so would save us less than $1,000 a year, and would probably not save us anything because we'd have to figure out how to account for it, and it would be pretty time consuming and problematic to do that. We probably would have to stop accepting credit cards, to be honest, because I don't think this is really feasible for us to do. So we could certainly bring in Mr. Picard if there's a specific question for Mr. Picard, but he doesn't have the inside books of any of his members or anybody in his organization. So I don't know that that's helpful at this point, Representative Arford. But
I was gonna say, forgive me, Madam Chair, I thought she had wanted somebody who might have heard the perspective of thousands of small businesses in Maine, and they would be that person. So forgive me, that's my
okay. I wasn't
sure
sure if Representative Arford wanted to know a number, like a specific estimate of how much dollars it would save. Is that what you were looking for, Representative Arford? Like information on the amount?
What I'm looking for is, on the face of it, we've had a significant amount of conversation amongst ourselves, but I'm still, my community borders on the Freeport community, and I really want to make sure I'm listening to the community as well as to the people in our committee as to what the impact will be on them. I don't have a clear understanding, so that's why I was looking for the dollar value.
Yeah. Okay. So you were looking for a number. Yeah. Go ahead, Ms. Representative.
I'm so sorry.
Yeah.
If you look at Maine Grocers Association, Christine Cummings did actually give one number. She has personal experience as well as now with her experience in her position with the Maine Grocers Association, that she estimated that the annual savings would be about $2,000 for a small convenience store, for example. That's in her testimony.
Okay. That's a concrete number. That's helpful, Representative Sachs. Thanks for pulling that out for us.
And so the only other part of that question would be the expense. Senator Sandborn, you'd mentioned that there would be a significant expense for your business to initiate this new program. And so I'm going to ask the sponsor if you have a sense, or if there's anybody in our attendee list who might be able to answer what the expense might be to a smaller business to start this new way of processing credit card fees.
Again, I believe you were sent that information in a pretty wonky letter, which I of course love, from Curtis Picard. So again, I would ask that, as he is far more of that expert in terms of the mechanics of how that would work than I am. So if you'd like to have him here, I know he's available to talk.
That would be excellent. Just a very quick answer to that question.
Okay, Mr. Picard can join us.
Good evening, Senator Sanborn, Representative Tepler, members of the committee. I'm Curtis Picard with the Retail Association of Maine. Thank you for the opportunity. As you've been discussing, we helped work to get a letter from the Merchants Advisory Group talking about the technological possibilities of doing this. But I also wanted to point out the actual text of the bill in Section 3, which talks about a rebate option, which we think is the far simpler one. So regardless of whether or not you believe that what we're saying, that this is technologically possible, and if the other side is saying it's not technologically possible, there's still the rebate option, in which case a retailer can simply submit their sales tax reports that they send to the state and receive a rebate back from the processor. And that's incredibly easy without any kind of additional expense, administration, what have you. It's really the cleanest way to do it.
Okay, Representative Arford, you had your hand up again.
Yeah, just very quickly, with the rebate option, would the business entity have the choice of not having to apply for the rebate, or would they, if this law was to pass, be mandated to apply for the rebate?
It's specified in the bill that it's either or, that if for whatever reason, the processor can't do it from the back end, and we believe they can because we believe that sales tax data is already being captured, they should be able to do it automatically. But if they say they can't, then the rebate option is an option.
Representative Tepler.
Thank you, Madam Chair. So as I understand the genesis of this bill, Representative Sachs heard from some of her constituents who are struggling with the cost of, with the rising cost, I should say, of fees in processing credit cards for payment during the pandemic. And she came to you, Mr. Picard, and this was a solution that you potentially offered her as something different than has been tried before. Am I understanding that correctly?
That's absolutely correct. We gave Representative Sachs the long history of credit and debit card swipe fees, both at the federal and state level. We talked about the surcharge option. We also talked about a sales tax collection allowance or a vendor allowance, which you probably remember from your time on the taxation committee. And those bills also die because there's a direct fiscal impact to the state. So the reason we brought forward this bill is there's not a fiscal impact to the state. And it's something new and different that also doesn't touch on the surcharge issue, because I know where the will of the committee is on that issue as well.
So let's talk for a second about this rebate option, where if a business owner calculates the amount of sales tax that was paid on their credit card receipts annually, and they can submit that to the processor should offer them a rebate on that amount?
Correct.
On the fees that were paid on that amount?
Correct.
How difficult is that piece of accounting for a business that has both credit card, cash, and check receipts?
Not at all, because you're already submitting the reports to the state monthly with your monthly sales tax reports. So you report your cash sales, you report your credit card sales, and you report the tax due.
You report them separately?
No, it's one
No.
lump sum in terms of the total revenue that's taxable. So the taxable revenue gets reported to the state.
Okay, and I think what I'm seeing as heads are shaking around me is some concern that those things aren't as easily separable as you are suggesting. So that's, I'm going to be quiet now and let Senator Brenner take it from here. But that is,
Senator,
that's what I'm
great.
hearing.
Thanks. Senator Brenner, go ahead.
Thank you, Madam Chair. And thank you, Representative Sachs, for your thoughtful piece of legislation, and Mr. Picard for staying late to join us. So I have a small business. I grow flowers on my farm. I pay sales tax on everything that gets sold from the business. I have wholesale sales that don't get charged sales tax. I have different POS systems depending on whether or not people are in my farm stand, whether I'm selling to them online. They're different companies, they're different processors. It would be a complete nightmare for me to get into QuickBooks and try to divide it all up and send reports to all of the different processors. I do my books while I'm in caucus at lunch. Like, this is small business. This is citizens legislature. This is not a bill that's going to move Maine's small businesses forward. There is just not enough savings in this bill for my business for me to feel comfortable voting for it. So as thoughtful as I think the intention is, I'm just not sure this is the right vehicle, and I'm sorry, but I can't support it.
And I'll just clarify that when I can run lots of reports. I can run a tax report. I have 2 different sales taxes that apply at my business, depending on whether someone consumes the product on the premise or takes it away. So some of my transactions are taxed at 8% and some at 5%, but it's by item. So actually the tax rate is by item. The transaction type would then be, cash or credit or other. But I can't slice and dice the numbers in that way. And I also have multiple POS systems with an online system as well. So I would really confirm what Senator Brenner says. This is a headache, and it would not be worth my time at all to sort this out. Nor would I expect to be able to obtain credit card processing services for the same price as someone in New Hampshire, where they didn't have to issue rebate checks of potentially like 10 or 15 bucks to some small retailers, to hundreds of small businesses or thousands of small businesses every single month or whatever. So I would be very concerned that this would negatively impact my business on balance. For sure. So I appreciate the effort that went into it, and I do appreciate the impetus behind it, that it's creative. I just don't think it's workable. So I'm ought not to pass on this bill. Is there any additional questions for Mr. Picard or Ms. Representative Sachs? All right, seeing none, I'm going to send you guys back through the wormhole so we can complete our work session. Thank you both for joining us so late. I don't think we have an official motion, but multiple folks have said it. So I'll just say move ought not to pass. Is there a second? Seconded by Representative Connor. And is there any further discussion? All right, seeing none, the clerk will call the roll.
Representative Quint.
Yes.
Representative Quint, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Sorry, I don't have any video, so I'll be in touch with you. My vote.
Representative Matheson's absent technically. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yeah.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 11 yes and 2 absent.
All right, 6 p.m. friends. I couldn't actually count all the votes we took today. I think we disposed of something like 19 bills today. Is that right, Colleen? Do you know?
Well, I think it's more. I think it's 24.
24 bills
Well,
we
I think
disposed of?
we tabled
a few.
4. We tabled 4,
Yeah.
I think. But 20
Okay.
of the 24, I think. So you did great.
All right, good work, everybody. A lot of unanimous reports and a lot of bipartisan divided reports too, which are always a kind of a sign, I think, of good, healthy discussion. So yeah, great work today, guys. That was much more accomplished in one work session than I have ever seen done before. So we may have the opportunity to do it again because we've still got more than 20 bills left to dispose of as well. So stay tuned. But we will also be talking tomorrow probably about when we can reschedule those bills that that did need to be postponed today or that were tabled today. Representative Tepler, go ahead.
Thank you, Madam Chair. I just want to say that I do have a chairs meeting at 8:30 a.m. tomorrow. Don't know if we'll be done right at 9, in which case I will be a little late to committee.
Okay, great. So we're starting public hearings tomorrow at 9. Colleen, is that right?
Nope, I thought it was 10, so I'm confused.
All right. All right.
Aren't we? 10
I'm
o'clock,
also
Christian?
confused.
It's 10.
Okay.
Oh,
It's 10.
never
So
mind.
Representative Tepler's just confused us all for no reason, but that's
She
okay.
did
It's
that.
6 p.m.
She did it on purpose.
Yes, I did. Thank you, Madam Chair. I could have sworn we discussed the 9 a.m. start time.
I think
It
we
was a
did, but
test and we
decided not
passed.
to. Yeah.
I think we did, but we didn't actually notice it for that. So I think we should stick to 10 a.m.
Okay, well, I'm happy with
Okay.
that.
Yeah.
Good.
All right. Okay.
I just want to say one more thing. I have been getting questions about the telehealth bills. Are you planning on doing them individually or grouping them, and how much of a time limit? Just a question, if you know. Otherwise, you can tell me tomorrow.
Yeah, we'll send that information out as well as announce it tomorrow.
Okay,
but we'll send it to our interested parties list tomorrow. It requires that I read the bills first to decide how they can be grouped, if they can be grouped.
I got a list. I can group them. I'll send you an email. But
All right, send me an email if you would, because I haven't read all the bills yet, and so I don't have an answer. I have a suspicion, but I don't have an answer. So to be determined, but we'll let you know with 24 hours notice. How's that sound? Okay,
I
great.
think that's it. I didn't have anything else. Thank you all very much.
Thank you, chairs and lead.
Thanks, everybody.
Thank you, everybody.
evening.
Have a
Have a
good
good evening.
night.
Oh, thank you.
Christian, I'll come down. You need how much time?
Colleen, do we have a meeting tomorrow for scheduling